The Senate Committee on Health and Human Services will come to order. The chair lays out House Bill 4795 and recognizes its sponsor, Senator Hancock, to explain the bill. Senator, I understand there's a committee substitute. Senator Blanco sends up the committee substitute. The chair lays out the committee substitute for House Bill 4795 and recognizes its sponsor, Senator Hancock, to explain the differences.
Yeah, thank you, Madam Chair. House Bill 4795, during the interim, we worked with the local adoption attorney to cut through the red tape that caused backlogs in the paternity registry system to help him finalize the adoption cases. House Bill 4795 requires DSHS Vital Statistics Unit to establish an electronic process in order to speed up, and DFPS in order to speed up amount of time to verify the paternity during the adoption process. The committee's substitute reflects a change to the implementation date from January of 2026 to April of 2026 at the request of DSHS to ensure there is a sufficient time for the system updates.
Members, any questions? The chair calls Alyssa Jacobs and Heidi Cox. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
Thank you, Madam Chairman, and thank you, Senator Hancock, for bringing this issue to this committee and to this chamber. I'm Heidi Cox. I'm here on behalf of myself and the Gladney Center Adoption Agency, testifying on the bill. When the bill was in the House, I actually signed up in favor of the bill, and at that time, it put a 10-day requirement for the department to do it, or the vital statistics to have a turnaround on the request. Similar to the request we make now for a court of continuing jurisdiction, it's statutory that the Bureau must return those within 10 days. So that bill had a 10-day turnaround, and I know it was trying to automate it as well. And I see that that has been taken out of the bill. So although the Department of Family and Protective Services can receive quick turnaround and get their own documents from the Bureau, in my cases, we would not be able to do that. We're seeing, this was put into place, the registry was put into place probably 15 years ago so that women could make a confidential adoption decision without having to go and track down all the sexual partners, while also giving men the opportunity to show their interest in a child. So it was a win-win. It's free and everyone can access it, and it's well publicized. It was also to create efficiency so you could finalize an adoption in less than 18 months. Now that has gone away because the efficiency within vital statistics is no longer there with this particular getting the registry. And it was efficient until 21, 22, that time period. I don't know what happened at that time period where we went from a more automated system to now it's snail mail with paper checks. And things get lost, it goes to a mail house, and if you call, you are given a secret number, and then you can keep calling back looking for that number. But things have been lost. Things have taken sometimes 4 and 5 months to receive back. So it's just delaying things, and we can't move forward without it. So I would really request that you look at this and see if we could have the 10 days back, even if it's not automated. I don't mind sending a paper check if I could get a quicker turnaround and have some accountability. Thank you.
Thank you. Thank you for your testimony. If you would state your name for the record, who you're with, and your position on the bill.
Alyssa Jacobs. I'm an adoption attorney in Texas, and so I'm here representing my agencies.
If you could lean into that microphone and speak up, yes. Thank you.
I'm here to testify on the bill. I share all the same sentiments that Ms. Cox just stated, and I am excited to have an electronic paternity registry, but I'm disappointed that there is not a front-facing version for the other half of adoptions in the state to access, given the way this bill is currently written. I submit hundreds of these requests each year and run into significant delays. And I don't know that taking the workload off of the current vital statistics unit by allowing the department to run their own searches will give us any accountability to get these searches back on a timely manner. I also run these searches with other states, and Texas does have the longest turnaround time. There's states like Florida and Illinois have online registries that we can go search and get instant results back. And I would like to see something like that in Texas. If not, have the 10-day language added back in. We do run court of continuing jurisdiction search results, which is also in this section of the statute, and we have no issues with getting those results back timely with that 10-day language in there. Just for example, I have a baby that was born in February, went home from the hospital with the adoptive parents. One of the alleged fathers is registered. It is now end of May, and we don't have those results back because he registered and we are going through the records department. Baby is perpetually in limbo until we can figure out, get those results back, and then figure out if he has a right to the child. So, thank you for your consideration.
Senator Hancock.
Madam Chair, we're in a total agreement with those that testified, but to get rid of the fiscal note, we had to get rid of the 10-day timeline.
Okay. How much was the fiscal note originally? It's in there.
Yeah, 3.
Or 4.9.
Yeah, a little over 3.2. I know, and I mean, they're here, they may be able to answer the question, but yeah,
Yeah, we do
we
have a-
agreed with the House bill, we just couldn't have a fiscal note.
Right. The chair calls Tara Doss with Department of State Health Services as a resource witness. Is Tara here? She's here. Here she comes. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
My name is Tara Das. I'm the State Registrar at Department of State Health Services, and I'm here as a resource witness on the bill.
Okay, great. Senator Hancock, you want to ask a question?
Well, obviously, the fiscal note, we were told
Yes.
we got to get rid of the timeline to get rid of the fiscal note. Why don't you first share why? What makes the difference in that, and what caused the fiscal note?
So the fiscal note is really about the impact of making the services online. We agree that the services should be made online, and the way our current e-commerce portal is on texas.gov in collaboration with DIR, Department of Information Resources. So the fiscal note was calculated in collaboration with them. And so you're right, the fiscal note, when it's about making the service available online for all applicants, the texas.gov component was 2.4 million, and then our HHS-IT also had staff aug and IT costs, which made for a total of 3.182 million, and it's all technology costs. That's not a vital statistics specific program cost.
And then if you would share with us the difference, we're talking about how things operated till what, 22, right? So something changed within the last few years. Can you tell us what changed to cause the delays? And then finally, the question of, can you explain why a request that goes back to February has not been fulfilled in April? May?
So our requests typically, they come in now by mail, and there's a check or money order mail payment that is done with that, and it's processed by the comptroller's office. The payment is before the order is submitted to us. From end to end, so that piece of the processing takes about 2 weeks. And then we take an additional 4 weeks on average on top of that. But however, if the application is not properly completed, we return it back to the applicant to be resubmitted, and then the clock starts again. That's the current process. To answer your question of what happened from a couple of years ago to now, is that in the past, with the payments that were coming in, our agency, our program was accepting credit card information written out and receiving by fax, which led to some privacy breaches. And so we had to switch that to accepting all of the payments by mail until we could have had an online process.
So the acceptable timeline is 6 weeks. or the unacceptable, acceptable timeline is 6 weeks. Madam Chair, I think we have, and the facts that she's using the word fax something in, sounds like we have IT issues.
Sure. The fiscal note being from DIR. Anyway. Okay, any other questions? We'll work through this. Anyone else wishing to testify on House Bill 4795? Hearing none, we will leave this bill pending at this time. The chair lays out House Bill 4454 and recognizes its sponsor, Senator Johnson, to explain the bill.
Good evening. Thank you, Madam Chair and members. We have here House Bill 4454, styled patient brokering. We already have prohibitions on illegal referrals from one entity getting something of value.
If you can speak into that.
Yes, I'm not used to this. Aha, this chamber. This is about patient brokering. It is about protecting consumers from harm, updating regulations, and combating something called patient brokering in the healthcare industry. Patient brokering is the illegal exchange of something of value for a patient referral. Those engaging in patient brokering may use deceptive practices or marketing schemes to direct a prospective patient to one service provider over another, and that very often will not be in the best interests of the patient. We already have provisions in Texas law, specifically Chapter 164 and Chapter 102, Chapter 164 of the Health and Safety Code, as well as Chapter 102 of the Occupations Code. This bill updates those sections to make them applicable to things that previously were not encompassed because they're old provisions, and tightens up the language so that we can more effectively prosecute and prevent fraud. Specifically, we create a task force that will be charged with working with HHSC and the Attorney General's office to account for the number of times that this is happening and make recommendations to the legislature for laws that we can then pass to further reduce this kind of abusive practices.
Members, any questions? Thank you. Senator, we had 7 witnesses registered for, 2 against. Not sure who that was. And we'll find out. And for reference in the notations. Members, any questions for Senator Blanco? Appreciate it. Who? You have a question? Seriously. I'm tired. I'm going to get my second win. I'm going to have some kombucha and everything's going to be great, okay? Any other questions? No questions? We'll leave this bill pending at this time.
Thank you, Madam Chair and members. Thank you. Invitation, but I don't know what I work on that.
The chair lays out, Senator. Yeah, that's true. The chair lays out House Bill 1052 and recognizes its sponsor, Senator Blanco, to explain the bill.
Thank you, Madam Chair, members. Last session, this committee voted unanimously to pass HB 3942, which is identical to this bill, out of committee, but the bill died on the final local and contesting calendar. This bill addresses a critical gap in the Texas Insurance Code related to telehealth services. While current law requires health plans to cover telemedicine, teledentistry, and telehealth services, it does not clearly authorize coverage when either the provider or the patient is temporarily outside of the state. So this bill seeks to close the gap by clarifying 2 key points. One, that telehealth coverage applies when the patient or provider is out of state as long as their primary residence is in Texas. And 2, the provider must be licensed to practice in Texas and maintain a physical office in the state of Texas. We do have resource witnesses from TDI here. With that, I close.
Members, any questions? We have no one that wants to testify publicly. We have 9 registered for, 2 against. We have a resource witness. Members, do y'all need any resource witnesses? Is there anyone wishing to testify? Hearing none, we will leave this bill pending at this time. The chair lays out House Bill 4099 and recognizes its sponsor, Senator Perry, to explain the bill.
Madam Chair, physical therapy, 30 days by Representative Harris Davila. Physical therapy is the least invasive, most cost-effective option for many injuries, both patients and insurance. HB 4099 builds on the legislature's 2019 success, allowing limited access to physical therapy, meaning patients could see a physical therapist without a referral for a set period. The law lowered costs and improved access to care, and it was passed on a broad bipartisan support. The bill expands the access from 10 calendar days to 30 calendar days, consecutive days, putting Texas in line with 41 other states, where it has worked very effectively. Texas is one of only 9 states limiting patients to less than 30 days. In the 6 years since Texas had adopted direct access, there have been 0 safety complaints filed by any regulatory body.
I have a question.
Yes, ma'am.
And we can call, I think Zeke Silva, I'm not sure Zeke is still with us today. So Craig Townget, I believe it is, Townget. So currently, as you mentioned, the what we have is 10 days direct access to treat a patient without a physician referral, and 15 days if they have done the residency. It's kind of a higher level PT. What this would do is just do everyone 30 days.
That's basically my understanding.
So why do you think in the past that there was a split between the residency PT and the just regular PT?
I don't know the distinction between that certification above the regular PT. Having been a recipient and a very regular participant in PT, it was really frustrating to have an injury on Saturday, have to wait to get in to see a doctor probably Wednesday, Thursday, Friday the next week, swelling in ice and all the things that you do to know to do, only to have them, when you go in and get that, they say, well, you need to go to get physical therapy. So I think just the sheer waiting period prolongs treatment unnecessarily, at least from my personal experience. And I would say that the record of not having any safety complaints, I think if you have a back injury, something like that, where MRI is requested or things, but I think most of these PTs are looking at pull muscles, bad sprains, those kind of deals. But as far as the distinction between the certification that's 15 or 10, I don't have that background.
Okay.
I wouldn't know.
Get that. If you would, state your name for the record, who you're with, and your position on the bill, and you may begin.
My name is Craig Tungett, and I am the Executive Director of the Texas Physical Therapy Association, and I am for the bill. This bill does nothing except expand the amount of time that patients can see their physical therapist through direct access. It has been 10 or 15 days. That was a compromise that was made 6 years ago when we first passed legislation in order to get direct access of any kind. There is, as Senator Perry said, there's been no safety issues. You will not hear of any true legitimate safety concerns. And that's proven out not only in the 6 years of experience that we have, but in the 41 other states, the District of Columbia and the United States military, which all offer at least 30 days. Half of them offer unfettered access. This is not a new concept. Unfettered access was first passed by Nebraska in 1957. In the 68 intervening years, they have seen no need to try to roll it back for safety concerns. There is not a safety issue. What this does is allow patients to see the physical therapist so that they can get their treatment without the additional time and expense of having to get a referral from another provider.
Thank you.
You
Senator
wanna-
Perry?
The distinction between the 15 and 10, that certification, can you answer that?
Yeah, that was, as I said, that was a compromise that was made 6 years ago. The difference is that the fellowship and the residency and the board certification, they do have a little bit more training. They do have a little bit more of, not necessarily experience, but they have a little bit more training, a little bit more classroom exercise and clinical exercise that they've done. But the other states, no other state has a distinction like that. Of the 41 other states, none of them have a distinction like that.
People getting certified today in the PT world, are they choosing the upper end of the credentialing, or are they staying on the bottom?
I'm sorry, Senator, I didn't.
The people that are currently graduating 6 years later out of PT school, are they going to the upper end of certification more than not, or are they staying in the baseline?
Well, they will initially be in the baseline because they have to get that certification after they get their doctorate.
Okay.
So it is an additional
So
certification.
that's not the distinction between the 10 and 15. That was just a stage in which that PT was in, but all of them ultimately end up to be the certification.
No, sir, not all of them will get the certification. That's a voluntary thing.
Okay.
All of them get their doctorate. They have to get a doctorate to get licensed. But then that's a voluntary thing whether they become board certified, just as it is in many other professions.
Thank you.
Members, any other questions? Thank you for being here tonight. We have no one else registered for the bill. We had 9 register for, 6 against. With that, we will leave House Bill 4099 pending before the committee. The chair lays out House Bill 1942 and recognizes its sponsor, Senator Perry, to explain the bill.
Thank you, Madam Chair. APRN direct contracting with HMO PPOs. 2017 SB 654 allowed APRNs to accept Medicaid patients regardless whether or not their designating physician is in the Medicaid plan. The relationship between the APRN and designating physician was unchanged, but it allowed APRNs to seek broader groups of patients and also allowed physicians to act as a designating physician without having to contract with those plans. HB 1942 extends the same flexibility to state-regulated health plans to further increase access to health care. Under the bill, APRNs would still have the exact same requirements in working with their designated physician that they have today while increasing access to care by applying these changes to state-regulated health plans.
Members, any questions? So basically, an APRN can be registered with an MCO without directive from a doctor.
It doesn't change the relationship with the doctors, but they
But
can.
the doctor might not be in network.
Correct. The doctor
Right.
may not be, but they would be, and it still has the same relationship as far as oversight.
Okay. The chair calls Aaron Perez. Aaron Perez.
Evening.
If you would state your name for the record, who you're with, and your position on the bill.
Yes, ma'am. Good evening, Madam Chair, Full Course Committee. My name is Erin Perez. I'm here to testify in support of HB 1942 on behalf of myself, Texas nurse practitioners, University Health System in San Antonio, and as Live Oak City Council Place 3. I'm a master's and doctorally prepared, nationally board-certified adult and geriatric nurse practitioner who graduated from the University of Texas Medical Branch. I'm in full-time practice in supportive palliative care at University Health System in San Antonio. I want to thank Senator Perry for his leadership in carrying HB 1942 and Chair Colcourse for the opportunity to hear this important bill today. In 2017, the legislature passed SB 654 to help alleviate the lack of primary care providers in Texas. This bill changed the requirement that nurse practitioners only accept a Medicaid insurance plan if their delegating physician also accepts this plan. SB 654 passed with broad stakeholder support from the Texas Association of Health Plans, Texas Medical Association, Texas Nurse Practitioners, and others, and has been in effect for 8 years. While SB 654 made important progress and provided much-needed access for Medicaid patients, it excluded commercial insurance plans regulated by the state, which impacts an estimated 5.5 million Texans. In my local community of a tri-county region, this includes many hardworking patients who are self-employed or work for small businesses. Their insurance plans are not always widely accepted in our communities. Insurance coverage does not always equal access. HB 1942 passed the House almost unanimously with broad stakeholder support. It's a cleanup legislation that seeks to extend the same flexibilities afforded to the Medicaid plans to all regulated health plans in the state. It will increase flexibility for healthcare practices, improve patient choice, and expand healthcare access in Texas. We ask for your support of HB 1942 to extend access to more Texans. Thank you for your prayerful consideration and time and tireless work for service of Texas.
Thank you. The chair recognizes Senator Hughes. Welcome. I know you've been chairing another committee, and so it's great to have you join us today. When you say about, obviously having an APRN that's in network is important, why would it be that a doctor wouldn't be in network? It's just the relationship that y'all have and you're serving somewhere else?
Yes, ma'am. So a lot of times we have the same specialty, but in Texas, we are required to have a delegating collaborative physician. So sometimes that relationship does not equate to that physician being in network. And so all we're asking is for your respectful, favorable support in this. You all were lovely to support us back in 2017, and actually my Facebook memory just posted, and we were back here on the same day back in 2017 on the same day, and even in 2014 we were doing the same testimony and something similar. So, I would just respectfully ask that we allow commercial plans. This does nothing to change my practice, the scope, the delegation agreement. It just is a cleanup bill. So thank you for your time.
Thank you. Members, any other questions? Thank you for being here. There is no one else registered to testify on House Bill 1942, so we will leave this bill pending at this time.
Thank you.
The chair lays out House Bill 713 and recognizes its sponsor, Senator Cook, to explain the bill.
Thank you so much, Madam Chair, for the opportunity to lay out House Bill 713 by Representative Donna Howard. Members, the Texas Maternal Mortality and Morbidity Review Committee, I'm going to call it the MMMRC, is tasked with reviewing and studying cases of pregnancy-related deaths to provide recommendations to the state to reduce maternal mortality. However, the nurse's duty to report rule requires maternal death case records be redacted before they can be reviewed by a nurse working for the MMMRC. This leads to significant delays in processing the data and preparing the recommendations report. HB 713 grants a limited exception, so very limited, from the mandatory reporting rule for nurses and physicians working for the MMMRC, which allows them to review unredacted information and accelerate the process of abstracting data from maternal death cases. If you have questions, I'm happy to answer them. We do have a DISH's resource witness available if folks have questions. And yeah, happy to take questions.
Senator Perry.
I want to talk with the resource witness so I can kind of get a pretty good handle.
Okay, that would be probably DISH's.
Mm-hmm.
Who do we have? Amanda Hall. Is Ms. Hall with us?
Is that her? There she is.
There she is. Dr. Hall, welcome. If you would, state your name for the record, who you're with, your position on the bill, which would be on the bill. You may begin.
Sure. I'm Dr. Amanda Hall. I'm the Deputy Commissioner for the Community Health Improvement Division at the Department of State Health Services, and I'm here as a resource witness on the bill.
So,
Senator Perry.
Senator Cook's bill, and I'm not quite understanding whatever the issue is that we're trying to fix here, but can you give me just currently what is that process, I guess, for logging, reporting, and how does that work?
Sure. After we are determining the cases, we request the medical records, and they are coming in. That will then be turned into our case narrative for us to be able to review those cases. In order to get to that case narrative, we have to go through all of the records and put that together. But there's the Nurse Practice Act, and then there is the statute that governs the review committee, and they're kind of in conflict with each other because we need to be able to get those records into the case narrative, but in order to do that, we have to have clinical folks to be able to do it. And so that has to be abstracted to take out all of that identifying information for them to be able to put it into the case narrative.
So kind of back up from the get-go. So there's an event and y'all are required to get information on it and build a case file or a history or report that through our
Correct,
system.
yes, we have to get the
And you're
records.
relying on clinical and non-clinical processes to do that.
Yes, so we have to get the clinical records. There will be non-clinical records that we have to get to, so we may have police files and other notes, but all of that has to be redacted so that the nurses can then abstract the information out of it, create the case narrative for us to then be able to review the case, to then be able to make the recommendations.
So the redaction is personal information, names, those kind of things. What about age? Things that may be relevant to clinical age or any of the factors, personal identifiers other than name. Is that stuff still left in?
So I'm trying to make
I'm
sure.
sorry, I'm just asking what's left after, what are you redacting?
Sure. So what we're redacting, we're going to redact the names of any of the folks that may have been involved in the care, the name of the hospital, names of clinics, things of that nature are going to be what's going to come out. And then what we end up with is going to be the kind of the clinical information. So it will have the age. We will know how many weeks that woman was pregnant when she went in to deliver. We'll have the information about the delivery. We'll have information about the care she received before it, but it's taking out that identifying information.
Toxicity, if there was potential drugs or any of those kind of
Yes.
things, alcohol conversations, all of that would still be left in the.
Absolutely, yes.
And so your bill, Senator Cook, is trying to do what?
So basically, the issue is that if nurses are reading this information and there's something that's reportable, we have to report it. And so that's why they have to redact it. So it takes like anywhere from 45 to 250 hours, right, to redact a stack of these things. And so we're actually having such bad delays that we're not getting the numbers in time to be able to make basically advise in a timely fashion.
So it's kind of a two-way street. They get it, they redact it, they give it to you, and then you give them back a case summary? Is that how that works?
So we have a set of redactors. So these are going to be the folks that are going to go through those records. They're going to take out that identifying information. It then will
That's
go.
y'all, the department.
No, we actually have a contract with the University of.
But it's under y'all's
It is under
control.
our purview.
Y'all
yes.
contracted.
Yes.
So someone redacts all the private.
Redacts all of it. Then it's going to then move into the realm of that clinical abstractor, and that is a nurse. And then our nurses that we work with are then going to look through all of those records, and they're going to create a case narrative. And it's really going to tell us the story of what happened. And then by reviewing that, I can look at it, I can look and answer specific questions that help us understand what happened during the course of that woman's care, which then will allow us to be able to make those recommendations around those preventable pregnancy-related deaths.
And that data is used in where we're getting our research numbers from, on morbidity and those kind of things.
That is where we get the information for the report. So the report that we give to y'all every 2 years, that is where that information is. We also have a lot of data that we work with, more of our administrative data, and that data can be found on Texas Health Data. So it's kind of one piece of the work that we do around this.
So one more time, you're just asking for limited redaction or no redaction to expedite the process?
We're looking for these nurses to be accepted from their mandatory reporting, just under this one situation, so that they don't have to redact. They can just give the nurses the info, the nurses read through it, but then they don't, that's correct, right? No mandatory reporting.
So basically, you're saying bypass the redactors, get it to you straight as is, way it was, all records. You do your job, give it back to them.
Yeah,
correct.
That's what the bill's asking.
Y'all are talking about a lot of redacting, but I'm not reading redacting here. Nurses are mandatory reporters, right?
Yes.
So this is just basically saying if you saw something that was done wrong, you don't have to report it.
If the nurse who was practicing at the time saw it, they still do. But the nurse who's reviewing the file for the purposes of the Maternal Mortality Review Committee, whatever.
I'm going to just use an example. Let's just say a doctor actually might have attempted an abortion, it went wrong, the patient died, you're reviewing this, you know that he's done an abortion, it's not allowable under the law in the state of Texas, that would exempt that nurse from reporting it.
So we don't have the identifying information when we would review the case. I would say in that example, there's actually, those cases don't go to the review committee. There's in our statute, it states that we would not review cases that were related to either a termination of pregnancy. So we would not see the abortion cases. But we are not reporting on cases where we saw there was an instance of something went wrong and say that the nurse who was abstracting it would not have that information to then turn and report on that.
But again, the nurse practicing, like the nurse in a delivery room or the nurse caring postpartum, would have the duty to report. This is after everything's done. This is just reviewing cases.
Senator Perry.
So I'm trying to, I guess we've got a middleman for independence, because to me, if I have a nurse in the delivery room and something happens or whatever the situation is, why is that the primary and only source you need to document? Is it just all the extraneous factors you bring in an investigation that they're making that? I guess if someone was there, that's what happened. Why do we need an independent process that you send it off to have them develop a narrative of what happened? Is it because if the person didn't do their job, you want that independent support? Why is the extra step?
The extra step around the redaction.
Why are nurses looking at it versus the person in the room that saw it and was there? She just made a comment. The one on duty would be obviously aware of what happened.
Right.
They're after the fact.
This is because it's part of the maternal mortality.
No, I understand it's a process. I'm just trying to figure out now, well, why do we have that step? What is it, to build an investigation file?
No, we are building a case narrative to be able to review the case, to look for opportunities around making recommendations for prevention. So it's not an investigation. This is more about being able to learn from those cases to be able to make recommendations to hopefully help keep that from happening in the future.
There's a point of incident, which that person can describe what that incident was, but then y'all's further background to build the history around that person's life as to what contributed to those factors that day. That's where y'all's role is.
Right, and this would be, I mean, it's like hundreds and hundreds of cases around Texas, right, that we're compiling.
I get that.
So, yeah.
What was that, Senator Cook? I couldn't hear.
Like this is hundreds of cases. They all get compiled to build the narrative to put a report out.
How often has a nurse had to report?
For the review committee, we haven't, because we have put that step in since the beginning. When we started the committee, we have always done the redaction around the records.
So by having this bill, it's really about 7 lines, 8 lines. I'm missing a step here. So by having, you've never had to report, but if we pass this bill, then what would happen? You wouldn't redact.
We would not have to have the redaction step before it goes to the nurse. And so then the nurse would then be able to take those records and then go directly into making kind of that case narrative. And so what we have done then is that we have taken out that step, which is very time consuming. It's actually the most time consuming step we have when we go through the entire process in the review committee.
So it is the nurse that creates the narrative. One of the things, this isn't in this bill, but then that nurse creating the narrative, I mean, we really have to trust that nurse, that narrative is not false. Like they might have a filter that you can make that narrative anything you want, right?
So we also have We have the ability to see specific data that has been abstracted out of those medical records, and so there are places within the context of when we're reviewing where I can go in and I can get more detail about a visit. So I can look at what they have written while I'm also able to go and see more detail. Once again, it's been redacted. I'm not able to identify a specific physician or a nurse or other folks or a site, but I can actually see more detail, and so I'm able to look at both.
And I'll just add, I mean, M&M is it's a fundamental part of reviewing medicine and the practice in general. And so in any kind of qualitative review, you've got guiding principles, best practices, things that keep you away from inserting your own bias. So you would be looking for instances of certain things. You'd be looking at vitals trends. You'd be looking at medications. So it's not as much like one person kind of just reading this and then typing it. It's a systematic process.
Mm-hmm. Very interesting. Thank you. Members, we have one person to testify, and that's Jack Frazee. Jack Frazee.
Oh, I think somebody left their phone behind for whoever that.
Probably.
If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
Thank you, Madam Chair and members. My name is Jack Frazee. I represent the Texas Nurses Association. We are for the bill. It's been pretty well discussed so far, but just to kind of dumb it down into layman's terms, the MMMRC is not meant to be an inquisition. It's really about gathering data and information. Unfortunately, the conflict of laws around the statute that creates the committee and then the Nursing Practice Act would trigger that duty to report for the nurse. So if they see all the information and there's not any exception to their duty to report, they have to make these reports to the Board of Nursing based on the Nursing Practice Act saying that they should report any kind of violation of the Nursing Practice Act that causes harm to these patients. So that's what has given rise to this redaction process, and if we exempt that duty for the purpose of this committee, then we don't have to waste all that time. So it's really a government efficiency bill.
Thank you. All right. Members, any other, did you time yourself?
I'm sorry, somebody left their phone behind, and I don't know why it's going off.
Well, you can answer it and tell them where it is. Your panel? Just say, hey, we're in the Senate chamber. It's 8:30 on a Wednesday night. Come join us. You left your phone.
I'll leave it with
Go ahead and answer it. Okay. Tell them we said hello. Is there anyone else wishing to testify on HB 7? Answer it, Jack.
Somebody
I'm
needs to
serious.
know where it's at.
Somebody, yeah, you give it.
Somebody needs to.
Brett, answer it. Somebody's looking for their phone. I'm really serious. I would want you to answer my phone. Tell them Senator Colcourse said hello. Did you do it, Brett?
You got to answer it because they're looking.
Brett has a 4.0 at UTPB, and he was studying for his MCAT all the while he was working here. Give him a round of applause. Let's have. Yeah, so he just got his grades back, and anyway, super impressive, and we're looking forward to you practicing medicine one day. All right, that was a little levity for the moment. Anyone else wishing to testify on House Bill 713? Hearing none, we will leave this bill pending at this time while someone continues to look for their phone. Brett, if it rings again, answer it, okay, buddy? All right. The chair lays out House Bill 3159 and recognizes Senator Cook to explain the bill. 3151, 3151.
Thank you so much, Madam Chair. For the opportunity to lay out House Bill 3151, members, federally qualified health centers are critical to our state's healthcare landscape, especially a lot of neighborhoods in my district. This nonprofit health centers serve 1.8 million Texans, including 600,000 Medicaid patients, and do a fantastic job. When an FQHC opens a new clinic, so a chain, a group, they open a new clinic or adds a new provider, the new clinic or provider is required to be credentialed with the numerous managed care organizations in the applicable service area. However, FQHCs report long delays in completing the credentialing process for a new clinic and new provider. Moreover, depending on the MCO, FQHCs are sometimes not reimbursed for services rendered during the credentialing process. And I just want to reemphasize this. This could be an FQHC that already has existing relationships with the MCOs in the area, but they've opened a new clinic, which was desperately needed in a neighborhood, and they have to go through that entire credentialing process over again. It takes a really long time, and the whole time they're operating at a loss. So House Bill 3151 designates FQHCs and FQHC providers as providers eligible for expedited credentialing with Medicaid MCOs to reduce administrative delays and support their ability to serve underserved Texans. And if you look at the language, there's already an expedited credentialing process. So this just basically, instead of it being a provider with an existing relationship, allows it to be an FQHC with an existing relationship. I'm happy to answer questions.
Members, any questions? The chair calls Jana Eubank. Jana Eubank. If you would, state your name for the record, who you're with, and your position on the bill, and you may begin.
Yes, ma'am. I am Jana Eubank, and I'm with the Texas Association of Community Health Centers. And first of all, good evening. I really appreciate the opportunity to come and testify in support of House Bill 3151. As I mentioned, I'm Jana Eubank. I work with the Texas Association of Community Health Centers, and we represent all 79 FQHCs in the state who operate over 650 sites throughout the state. So as health centers, as Senator Cook mentioned, when we open new sites or we add a new provider to try to address community need, we are facing really significant challenges with both Medicaid provider enrollment and the health plan credentialing process that in some instances can take months. And in a worst case scenario, one or two examples, it's taken a year to get through that process. These delays result in slower or no reimbursement for patient care provided during the credentialing process, which negatively impacts our ability to cover our operational costs, including paying for the salary of the providers that we've hired. It also can negatively impact our ability to provide patient care because it can delay our ability to provide patient referrals, prior authorizations, and even prescriptions while we're waiting for this credentialing process to be completed. Because there's no uniform guidelines by HHSC on to MCOs on the credentialing process and when they have to reimburse, every plan handles it slightly differently. And so that just really, because we do go ahead and contract with all the plans in our service area because we want to make sure we're in network for all of our patients, it creates a lot of administrative burdens for the health centers who are not-for-profit safety net providers. So this bill simply amends the Texas government code for the Medicaid managed care section, and it adds FQHCs to an existing expedited credentialing process that both shortens the process to 30 days, and then it's clear that it allows for reimbursement during that credentialing process. It's retroactive coverage.
Sure.
There's no fiscal note, and we have negotiated with the Texas Health Plan Association, and they've been really delightful to work with, and so I urge
delightful to work with.
I
Jamie
know.
Dudensing, did you hear that? All right, great.
Yeah, so we would appreciate
Members,
your
any
support.
questions of the witness? There's no one else that's registered for the bill. There were 11 for, 3 against. With that, we will leave this bill pending at this time.
Thank you.
Thank you for being here. Don't forget your phone.
Okay. Don't.
All right, chair lays out House Bill 4638. Recognize sponsor Senator Colcourse to explain the bill. 4638.
Thank you, Mr. Chairman. I'm glad that we have one of our interns, Brett, here, our 4.0 MCAT study.
They can't answer a phone.
Yeah, he's doing great. He didn't say much, but we know he's smart, for sure. He helped me with this bill. Members, last session I sponsored House Bill 4990, which created the Texas Pharmaceutical Initiative with the goal of reducing the cost of prescription drugs for taxpayers, employers, and consumers. HB 4638 by Dr. Bonin is a cleanup bill to address some of the different difficulties realized by the initiative. It does, let me just walk through this real quick. HB 4638 adds 2 additional board members to prevent quorum issues. As you know, when you only have 3 board members, if you expand it to 5, you allow 2 to meet at any given time, and that makes it more efficient. We did that with TxDOT and some of our other boards through the years. Moves the due date for the business plan to June of the even-numbered years and establishes a sunset date of 2033. It adds language to clarify the role of the initiative members. The TPI is really an answer to trying to cut cost. The state of Texas, in many ways, would become its own PBM for our ERS, TRS, UT system, and Texas A&M system. It's a bold idea. I would say that some lobbyists would be against this because it is a disruptor. I really believe that this is a disruptor to the system and something that is badly needed.
With that, members, any questions? All right, chair opens up public testimony for HB 4638. I show 4 registered, no wishing to testify publicly, and 1 on. Is there anyone else wishing to testify on, for, or against House Bill 4638? Hearing none, public testimony is closed. Chair lays out House Bill 5154 and recognizes sponsor, Senator Kokorsh, to explain the bill. 5154.
Thank you, Mr. Chairman and members. House Bill 5154 by Representative Wilson seeks to modernize and strengthen the JAMP program that was established by SB 940 in the 77th regular session by doing the following. It clarifies the governance structure of JAMP, the JAMP Council, including procedures for selecting leadership and ensuring regular meetings. It expands reporting requirements, ensuring the council provides detailed updates on student outcomes and program implementation challenges. The bill improves financial transparency by requiring clearer accounting of legislative appropriations and private donations, and it establishes an online feedback portal to allow students to anonymously submit concerns or suggestions. Members, JAMP stands for Joint Admission Medical Program, which supports economically disadvantaged Texas students pursuing medical education. The bill updates outdated statutes and clarifies the governance structure, enhances financial transparency, and expands the reporting requirements for greater accountability. I will just say that JAMP has been around for a long time. I actually modeled RAMP, which was the Rural Access Medical Program that is inside of one of the bills moving in the Texas House after this program so that we could identify rural students. This has been very successful through the years in getting young people that are socially economically challenged into looking at the fields of medicine.
Members, any questions? Do you have a resource witness for the JAMP program? Any got questions for the resource witness? Does anyone else wish to testify on, for, or against House Bill 5154? Hearing none, public testimony is closed. Chair lays out House Bill 2851 and recognizes sponsor, Senator Kokorsh, to explain the bill. I do understand there is a committee substitute. Senator Kokorsh sends up committee substitute. Chair lays out the committee substitute for House Bill 2851 and recognizes sponsor, Senator Kokorsh, to explain the difference between the bill and the substitute.
Thank you, Mr. Chairman. House Bill 2851 requires all consolidated application services, including the Texas Medical and Dental Schools application services, that is the TMDSAS, to include applications for Texas nursing schools. The bill also establishes an advisory board made up of representatives from various Texas nursing programs to develop and publish recommendations on integrating nursing schools into the consolidated application service. The advisory committee will expire on September the 1st, 2027. The committee substitute changes and the changes are this. They add a reference to the Texas Health Education Service through the bill, which currently operates the Texas Medical and Dental School Application Service, and this change incorporates feedback from the University of Texas system. Members, this came from a work group, the nursing shortage workforce work group that the governor had set up during the interim to address the challenges we have in getting more nurses into our medical system.
Chair opens up public testimony for House Bill 2851, calls Jack Frazese and Victoria Ford. While we're doing that, Senator Colcourse moves the adoption of the committee substitute for House Bill 2851. Is there objection? Hearing none, motion is adopted. Jack Frazese and Victoria Ford. Victoria Ford. Is anyone else wishing to testify on, for, or against 2851? Please come to this registration and come to the panel. Go ahead, Jack.
I do not have.
Got to answer those when people are calling, they're looking for it.
Good evening again. Just to let you know, Victoria had to go, so I will be here as the only witness. I want to thank Madam Chair for bringing this bill. I'm sure you recall, Madam Chair, last session when we were looking at all of the workforce pipeline issues. One of the challenges that we have in the state is that we measure qualified applications, not offered admission to our nursing schools. That does not mean qualified applicants. So we have this duplication rate, and we don't know how significant is that duplication rate. The reason that we have that duplication rate is you have different application systems in each of the different nursing schools. They don't sync up, and our student privacy laws prevent us from actually saying who are the individuals that were applying to each of these. So we don't know how many people are out there applying. Do we have more people applying than we actually have slots for? Do we have fewer? And depending on the answer to that, you have wildly different policy challenges in front of you. So by getting this consolidated application service, you will allow folks to apply to a centralized system that gives us better data for policymakers to decide where do we need to direct funds to try and address the first part of our pipeline. And in addition to that, it also has the benefit of giving students a better view of all the schools that they're qualified to get into, and then makes it cheaper for them to apply to a bunch of different schools all at once. So there's a lot of benefits that come from this. It's going to take a little while to implement, but that's why the advisory committee gets put together in the bill.
Questions? Members, any questions for the panel? Appreciate you staying here tonight.
Thank you.
Thank you for being here. Anybody else wish to testify on, for, or against House Bill 2851? Hearing none, public testimony is closed. Chair lays out House Bill 2844, recognizes Senate sponsor Senator Colcourse to explain the bill. Do understand there's a committee substitute. Senator Colcourse sends up a committee substitute. Chair lays out the committee substitute for House Bill 2844, recognizes its sponsor, Senator Colcourse, to explain the differences between the bill and the sub.
Thank you, Mr. Chairman. When we file bills or carry bills, we usually give them nicknames, and this is the Food Truck Freedom, along with my Food Freedom Movement bills that I file. So, members, House Bill 2844 creates a uniform statewide licensing system for mobile food vendors to ensure consistency across the state. With this license, a mobile food vendor can operate in any municipality, county, or other political subdivision so long as they maintain compliance with any applicable state and local time and place regulation. This bill authorizes the Department of State Health Services or a local authority contracted with the department to conduct standardized health inspections for mobile food vendors. The bill also assigns food safety risk clarifications to distinct types of vendors. The bill clarifies penalties and emergency suspensions of mobile food vendor operations should a vendor not maintain compliance with the law. The committee substitute adds language from House Bill 5459 to define a small-scale food business as a legal entity established by a farmer or food processor with less than $1.5 million in annual gross revenue. This addition to the bill prohibits a county or municipality or public health district from requiring a small-scale food business or an employee of a small-scale food business to obtain a permit or pay a permitting fee to operate a food service establishment, temporary food service establishment, retail food establishment, temporary retail food establishment, or retail food store at a location for which the business holds a permit issued by the department. And lastly, committee substitute to House Bill 2844 authorizes the department to set and charge fees as the department deems necessary to perform its duties and administer its duties as designated by the bill. This is a bill that was drafted by Representative Landgraf and co-authored with Representative Raymond in the House.
Any questions, members? Chair opens up public testimony. Actually, let's go ahead. Senator Colcourse moves the adoption of committee substitute for House Bill 2844. Is there objection? Hearing none, committee substitute is adopted. Chair opens up public testimony on House Bill 2844. Call Scott Jeanson, Aaron Talaferro, Judith McGarry, Donald Mears, and Samuel Hopper. Scott Jeanson, Aaron Talaferro, Judith McGarry. Everybody still here? Judith's not. I don't think Judith's here.
She's gone.
Is Sam Hopper on the panel? Okay, so I think I'm down to Sarah Lewis. Come on up, Sarah Lewis. All right. State your name, who you're with, position on the bill in 2 minutes. We'll start with you, sir, and move that way.
Thank you, Chair Colcourse, members of the committee. My name is Samuel Hooper. I'm Legislative Counsel at the Institute for Justice. We're a non-profit civil liberties law firm that focuses on issues of economic liberty. I've been on a long, delicious food odyssey through Texas while working and campaigning for this bill. And what I hear consistently from food truck entrepreneurs is stories of opportunities foregone and growth plans abandoned because of the duplicative permitting rules that currently exist, where food truck entrepreneurs have to get the same inspection, the same license in every single town where they want to operate. And that can become hugely expensive while doing nothing to add additionally to public safety. So we think that by creating a single statewide permit for food trucks, it'll be an enormous boon for economic liberty, and also for the entrepreneurs and those with less access to capital, the kind of people that generally like to create and run food truck operations. So currently these burdens, as I said, they fall on first-time entrepreneurs, people with less access to capital. IJ has done a lot of work representing food trucks in litigation and through legislative advocacy work. We did a report in 2021, Food Truck Truth, and that found that mobile food vendors are some of the most over-regulated food businesses in the entire state. And that's not because they're unsafe, but because they're politically vulnerable. They often they're not able to advocate for themselves in the same way as some larger organizations. House Bill 2844 fixes this. So by creating the single statewide permit with consistent and standard safety standards, it still lets cities regulate what they need to regulate in terms of trash, noise, park access, and so on. This isn't about eliminating local authority. It's about ending arbitrary restrictions that block safe and lawful businesses from serving their communities. We've seen similar legislation pass in Utah, in Tennessee, and most recently this session in Oklahoma as well. So Texas will be joining a good group of pro-economic liberty movements by adopting this legislation. I'm very happy to answer any questions that the committee may have. Thank you.
Go ahead, sir.
Madam Chair, thank you, members. My name is Aaron Tolliver. I'm here to speak on the bill. I represent Tarrant County. So Tarrant County has been the beneficiary of a pilot program authorized by the 88th session, whereby the county public health department inspects and permits mobile food truck operators. Once we do that, those food truck operators can operate anywhere in the county according to standards that our public health department operates under according to statewide standards. So then, a mobile food truck vendor can go from South Lake to Arlington to the city of Fort Worth to Lake Worth, and anywhere they go, because the county permitted them and inspected them, they're good to go. Likewise, the city of Fort Worth has their own public health department. If the city of Fort Worth inspects and issues a license to a mobile food truck operator, they can operate anywhere in the county. That was authorized by the last session under a pilot program. Tarrant County was the beneficiary of that pilot. So I want to bring the committee's attention to a bill that's in Senate Local Government tomorrow, House Bill 1449 by Representative Capriglione, that expands that pilot program to all counties over 1 million people. So under the pilot program, one countywide permit, according to state standards, food truck operators can operate anywhere in the county. Public health is maintained. Entrepreneurship and innovation is encouraged, rather than a state takeover. So if this bill were to pass in its current form, it would eliminate the pilot program created by the last session. So I'd ask the committee to consider is take into consideration House Bill 1449, and if there's a carrot to be offered, then let the carrot be offered through the pilot program. But if you don't want to take the carrot, perhaps local government can take the stick of a statewide mandate, but let's offer carrots and sticks to local government as opposed to just sticks. I don't disagree with the gentleman's complaints here to my right. He's not wrong, I understand them. But I think in Tarrant County, we've shown a better way based upon legislation passed last session. Thank you, members. Happy to answer any questions.
Good evening. My name is Scott Johnson. I'm a member of the Legislative Committee for the Texas Environmental Health Association, and I'm here to speak against House Bill 2488. The comments made by my colleague to my right are spot on. House Bill 1449, which is a cleanup bill from the previous session of 2878, which was passed in the Tarrant County, Fort Worth area, really glues together and signifies exactly, I think, what is trying to be done here. No one at the Texas Environmental Health Association is arguing the fact that food truck owners should have to pay multiple permits. We believe that that's not acceptable as well. However, by having the state sort of come in and take over all of this, we're looking at a lot of unintended consequences. Right now, the state has approximately 45 inspectors to handle 12,000 food truck inspections, in addition to the fixed establishment inspections that they already do. Having counties and the state, as what is being proposed in 1449, would at least have somewhere in the neighborhood of, say, 500 or so inspectors statewide to handle this. The current bill as proposed could also leave open some issues related to things that are found on routine inspections that may not be, because those food trucks may not be inspected as normal. Many times in the past, we have found foods that have had illegal additives. We've found red dye number 3. We have found other items that are called whiteners that will make foods that have been oxidized appear not oxidized. These are things that people aren't aware that they're consuming, and if routine inspections aren't being performed, they're not going to be found. Additionally, food trucks tend to be gathering places. Many jurisdictions get complaints about food trucks opening up at 1 or 2 o'clock in the afternoon, or 1 or 2 o'clock in the morning, and having hundreds of people converge there. Street racing occurs, fights, loud music, noise, all types of things like that. The state will not be able to respond in an appropriate amount of time, whereas the county officials will, and will be able to prevent this. I'm happy to answer any questions.
Go ahead, sir.
Madam Chair and members of the committee, thank you for this opportunity to testify. My name is Todd Mears, and I am here on behalf of the Texas Environmental Health Association, which represents environmental health professionals working in food safety programs across rural, small town, suburban, and urban Texas communities. Texas is a really big state. We appreciate the bill author's intent to simplify and standardize mobile food vendor regulations. However, TEHA, or Texas Environmental Health Association, must respectively oppose the engrossed version of House Bill 2844, as it would shift responsibility for food safety oversight to the state without practical infrastructure to sustain it. Under current law, local health departments, many of which operate with registered sanitarians and environmental health specialists, conduct regular inspections, those field inspections that he was talking about there and so important. They respond to complaints within hours and ensure compliance based on the risk unique to their jurisdictions. In contrast, the Department of State Health Services performs routine inspections of mobile food vendors, but not at the frequency that would provide good widespread representation across the state of Texas. This bill would make the state solely responsible for license enforcement, while local governments are left investigating complaints and monitoring vendors without sufficient authority or resources. Additionally, the bill limits essential public health tools, such as no longer requiring mobile food vendor to operate with adequate commissary or essential preparation support facilities, which provide access to sanitation and food storage infrastructure. These are just basic safeguards, not barriers, that prevent foodborne illness and ensure sanitary operations. TIHA is concerned that this well-intended legislation will unintentionally weaken the food safety net that protects millions of Texans and worldwide visitors to our state and special events. We ask that any statewide framework continue to respect
Sir, you gotta wrap it up.
power
We're
local
on
health
strict
department
two.
programs,
Last sentence.
which are best positioned to rapidly ensure food safety in the committees that they serve. Thank you for your time.
There you go. All right, ma'am, on the end. Go ahead.
Hi. Good evening, esteemed committee members. Oh. Good evening. My name is Sarah Lewis, and I'm a food truck event coordinator for the Food Truck League DFW. I work with over 100 food trucks in the DFW area, and unfortunately, the legislation passed last session had some very negative impacts for trucks in the DFW area, in the Houston area. The Tarrant County permit is $600 right now, and the Dallas County permit is $1,300. Most food trucks cannot afford both. They must pick one or the other. If you live in the middle, you have to pick. And the trucks in the surrounding counties, the rural trucks, it's the same for them too. Many trucks, they don't even bother going to public events. They only do private events. So the other bill that allows for it to apply to counties over 1 million, it's a good bill. This is the gold standard. It would change trucks' lives. It's hard to underestimate how much this bill would change people's lives for the cost to come down to where it only is tied to the actual administrative cost. It would change their lives. I know trucks who spend $4,000 to $6,000 a year on permits in DFW. In order to afford that, they must sell tens of thousands of dollars worth of food, and they have not paid for the cost of the food or the labor or the gas. And most food truck owners come from low-income backgrounds. This is a great bill. It will protect public health. It will protect public safety. It doesn't affect zoning. And I encourage you to support it. It would change people's lives.
Madam Chair, I have a question just for you, and if you don't know them. So I'm trying to get my head around it. Why isn't there just a state standard for food vendors that you could allow to get the state seal and then let the locals do their enforcement as any public health food? I mean, why do we need all these different county standards? You just have the one, and then let the counties get paid to go out and enforce and stuff with fines and penalties for actions. So is every county unique in their food safety programs? Every safety. So,
yes.
So it's the way they justify the existence.
I
So
think that's kind of the goal here, you know. It allows
that's what I'm hearing.
the bill allows the state to contract with the local authorities to do the
So
inspection.
I guess the question would be is how come some food safer, what makes a distinction of food safer in Tarrant County if they're operating under the same public health safety standards in Abilene, Texas? It just makes sense, a state standard, and then if they go out and inspect them on a normal, everyday, like they do brick and mortar at the local level, there's fines and penalties assessed. I don't.
I agree. Mr. Chairman, what I was going to ask, you know, I mean, food margin is tiny, right? Mm-hmm. And it gets tinier the more food costs right now, right? When food prices go down, that's when you can hold your margin. People are used to paying a certain. You can hold it for a little while and then you adjust down. The consumer, you know, dictates your prices. If your price is too high, nobody's going to buy it. Nobody's going to come to your food truck, right? So the concern about the fees in, you know, like especially in a Dallas-Fort Worth area, if you look in my district, you know, if you're living in Washington County, you're going to probably do a whole lot of events in Brazos County and Harris County, Fort Bend County. You're going to, you know, so if you start to look at, I have to have a permit in every one of those counties because I'm going to those festivals, you know, it adds up to $4,000 or $6,000, $8,000 a year. It's pretty tough.
Many people go out of business because of this.
Well, I will just say this, guys. Y'all allowed me to pass, we passed to the governor, Senate Bill 541, which was the cottage food industry bill. I've been working on this issue for about 14 years, ever since I was in the House. And I did a little post on it last night, and just organically, you know, people literally said, you're changing our lives. Like, you know, and it allows a lot of people the extra income that they can do on the weekends, but also, you know, one lady wrote on my Facebook last night where there was that cap, and if I digressed for just a second, it was at 50,000. That was an arbitrary number that I chose 14 years ago. And she said, you raised the cap to 150,000, and she said, my son and I were both in the business, and we couldn't live on sharing that $50,000 because that was gross, right? And she said, now we're going to both be able to build our business. And, you know, the ultimate goal would be if you're a great food vendor in a truck, one day you're in brick and mortar, right? These are incubators. These are literally incubators, right? So anyway,
Senator Hall.
we'll work on this. I get y'all's conflict with $14.99, and I know both the authors of these bills, and so we'll.
Senator Hall.
Okay. Now, I think you have a great point there, Senator. We don't have county driver's licenses. We don't have county tags on cars. And this is not a brick and mortar facility. This is something that's mobile. So maybe, you know, something that it's a state license that is subject to county inspections, county oversight, or a policy that you get a license in one county. It's good to operate in any county. But something for something like this, and what we currently have, doesn't make sense. It's not. Granted, it was a pilot program to see how it worked, and I think we take what's learned from it. But a compromise there, where you get a license, either a state license is issued, and then the inspections and enforcement is done at the guy, just like, you know, local police pulling you over for driving too fast, but you have a state license on your car. Or you have a policy that you have a standard for what it takes to get a license. You get it in one county, and it's good in any county.
Well, there's no difference in this and the fair. In Lubbock, Texas, you have all these nonprofit vendors, and every one of them all week long get health inspectors, food and safety inspectors all week. If you're going to have an event, you got 5 food trucks there. If you want to go inspect them, and if you can find problems, shut them down or fine them. But, I mean, it's not that hard. It's just like another restaurant. It just happens to be on wheels. With that, any questions for the panel? Guys, thank you guys for hanging in here all day.
Yeah, thank
Appreciate
you.
it. All right, Chair calls up Elisa Tamayo, T-A-M-A-Y-O, Tamayo. Eliza, or Lisa. Calling one more time. Cheers. Anyone else? Oh, absolutely. Anyone else wish to testify on, for, or against House Bill 2844? Public testimony is closed. Down to the last one. Chair lays out House Bill 1586, recognizes its sponsor, Senator Colcourse, to explain the bill. There is a committee substitute. Senator Colcourse sends up committee substitute. The chair lays out the committee substitute for House Bill 1586, recognizes its Senate sponsor, Senator Colcourse, to explain the difference in the bill and the substitute.
Thank you, members. House Bill 1586 digitizes the immunization exemption affidavit form that is currently mailed to families to be filled out and notarized in order for children to attend public and private schools in Texas. The bill directs the Department of State Health Services to post the affidavit form on their website in a printable format, removing the delay of sending the requested dishes and having to wait for the forms to arrive in the mail. Members, HB 1586 does not change any school district reporting requirements. The school districts will continue to report the number of exemption forms they receive. Committee substitute to House Bill 1586 adds language from Senate Bill 407 regarding a healthcare facility's required policy for vaccine preventable diseases to include procedures for a covered individual to be exempt from the required vaccine based on reasons of conscience, including a religious belief, and the substitute also prohibits a healthcare facility from rejecting an exemption based on reasons of conscience, including a religious belief. Chair Hull and I have spoken. She's spoken to Senator Middleton, who had Senate Bill 407, which past the past the Senate, and they have been working together on this substitute. So with that, members, I will just say this about the form. You know, it actually happened to me when Jake was going to attend Baylor. You have to have the meningitis vaccine, which he had received when he went to TCU, and then he, redshirted there 2 years at Blinn, won a national championship, that aside, but goes to Baylor. He was going to stay in a dorm. He was about to turn 21 in 2 months, and he was only going to be in the dorm for that summer school stretch last summer. And I was like, well, we don't really need to get another shot. We should ask for an exemption. You're going to turn 21. The law doesn't cover you after that. Oh my goodness, that was a lot. I mean, like a lot to be able to get that and get it in time for him to get into Baylor Summer School, which was required so that he could take 2 courses. And I will just tell you that I just thought that I could go online and do it and it's digitized. It is not. So having said that, it's an interesting, we talk a lot about digitizing things, and this is an effort to do that. So,
Any questions for the bill, Arthur? Hearing none, chair opens up public testimony on House Bill 1586. Well, it's got a signature right there. 1586. Chair calls Beckel Harker Road, Michelle Evans, Alois Sutherland, Joseph Garza, and Terry Burke. Becca Harker Road, Michelle Evans, Alois Sutherland, and Terry Burke. Rekha Lakshman. I butchered that tremendously. That's you? Are you Rekha? I like that name. I just can't pronounce the last one. All right, how many did I end up with? So let's go Charles Stern. Jackie Schlegel. Schlegel. All right, she's here. All right, let's start with you, Rekha.
Okay.
And let's go that way. 2 minutes, position on the bill, and who you're with.
Great. Thank you. Good evening. My name is Rekha Lakshmanan with the Immunization Partnership. I'm here in opposition to House Bill 1586. Thank you for the opportunity to testify. For years, Texas has struck a delicate balance between parents' rights and public health and safety. Under current law, the parents of almost 120,000 school-aged children have successfully used the existing exemption system to exercise their right to opt kids out of vaccination. House Bill 1586 is an effort to fix something that is not broken. This bill is more than just a form. The form in question is a choice that comes with real responsibilities. We can support parents without putting other families at risk. We understand that occasionally the first day of school creeps up on parents and they need extra time to file their paperwork. In fact, Chair Hall's Senate Bill 94 would have facilitated that by streamlining the process without the collateral damage this bill could cause. Sadly to say, the consequences of this bill will not be unintended. Instead, they are completely foreseeable. If this bill becomes law, Texas is likely to see more illness, more death, and higher healthcare costs for families and business. Treating a school vaccine exemption as just paperwork ignores the risk it poses to children, classrooms, and communities. Efforts at bureaucratic efficiency that hurt public safety and cost taxpayers are, by definition, inefficient. Texans care about their neighbors, and Texas is better than House Bill 1586. Immunization policies are designed to protect as many people as possible, including those who cannot be vaccinated, such as infants, cancer patients, and children with immune disorders. The outbreak in Gaines County is not a coincidence. It is the canary in the coal mine screaming at the top of its lungs. 2 children died. The data is clear and common sense. House Bill 1586 will significantly increase the likelihood that other, potentially much larger counties will experience comparable outbreaks. Now is not the time to experiment with immunization policies in Texas. In closing, I urge the committee to vote no on House Bill 1586. Thank you.
Go ahead, Jack.
Thank you, Chair. I want to first thank Chairwoman Hull and Chairwoman Colcourse for carrying this important Texans for Medical Freedom legislation. My name is Jackie Schlegel. I'm the founder and executive director of Texans for Medical Freedom. I am in support of HB 1586. More importantly, I am the mother of 2 medically complex children, one who has profound special needs. I feel like if anyone is qualified to speak on this issue from both a policy and a practical perspective, I believe I am. So let's be clear about one thing. This bill is not about whether vaccines are good or bad. It's about 2 simple things: government efficiency, keeping kids in schools. And for the sake of clarity and honestly, I'm going to tell you this. None of my kids are unvaccinated, not one. Yet despite this fact, my family and others like mine are often used as political pawns in the debate over vaccine exemptions. So let me be crystal clear. If someone is testifying today that makes this bill about vaccination themselves, they are not being truthful and honest about what this bill is actually about. HB 1586 simplifies the process for Texas families to exercise a right that is already protected by state law, the right to file conscious exemption to school vaccine requirements. Currently, to obtain an exemption form, parents must send a written request to the Department of the State Health Services, wait for processing, and then wait even longer for that form to arrive in the mail, oftentimes with critical school deadlines looming. Guys, this is not parents. If you've ever waited on mail before, in the United States Postal Service, we call it snail mail for a reason. It takes a long time. These are the forms. These are the packets. This is what we're talking about, a piece of paper. I personally deal with hundreds of these issues every year. These are families forced to keep their children out of school for days or even weeks simply because the form didn't arrive in time. This is not a public health strategy. This is a bureaucratic red tape hurting children. The last thing I want to say, this is about access, this is about consistency, and this is about allowing parents to comply with the law without having to fight the system to do so.
Thank you.
Thank you.
Next.
Thank you, Chair Colcourse. Thank you, Chair Perry. I'm Terry Burke, and I'm here representing myself and my granddaughter, Ella. And I am opposed to this bill. But I want to tell you that I'm really proud of Ella, who celebrated her 18th birthday last week and immediately registered to vote the same day. And I hate to tell you, Chair Perry, she's your constituent.
Sounds like she's got a pretty cool grandma.
Well, yeah. In many ways, she's my mini-me. She's passionate about her views. She's determined to win the argument. And we'll see how she does when she takes you on, Chair Perry.
Tell her to take a $600 a month, another career.
Okay. I was really so proud of her when she told us that she had registered to vote. And then my heart sank when she said she had very little faith in politicians or the process. Wanting her to have more hope, I told her she was wrong, that I still believe in the important role politics play in governance. But I was actually not being honest, because I was dismayed by the path this bill has taken in the House. At the Public Health Committee hearing in the House, 49 people testified or registered in opposition, while 10 testified or registered in support. Public comments were overwhelmingly opposed to this bill, more than 120 versus 50 for it. Yet, HB 1586 passed out of that committee on a straight party line vote, and the same held true on the floor vote. This bill really is a solution in search of a problem. If you look at the counties where the measles cases are the highest, you will also see exceptionally high exemption rates. The process works. Maybe not the way I'd like for it to work. I don't want all those kids with measles, but there's a lot of exemptions out there. Parents are just not challenged by this process. Representative Hall says this is just about the form, but one of the most ardent supporters of this bill was quoted in the New York Times Sunday saying, "There's no other medical procedure where you have to get permission from the state to say no, and that's a barrier to liberty." So if it's just about the form, then I think the process works. If it's about liberty and freedom, then I think everybody needs to think about the liberty and freedom we're violating for those who cannot
Thank
be
you, ma'am.
vaccinated.
Is she in Lubbock by chance?
She's in Abilene.
Okay, well, I grew up in Abilene, so go ahead, sir.
Hello, committee. My name is Joseph Michael Garza, and I'm testifying in opposition to HB 1586. I'm a lifelong Texan from San Antonio and a recent graduate of the University of Texas at Austin, where I studied microbiology and infectious diseases and served as the president of our American Society for Microbiology Student Chapter. HB 1586 opens the door to more vaccine exemptions, more outbreaks, more suffering, and more deaths. Instead of loosening exemptions, we should support parents in making informed, evidence-based decisions about their children's health. Before the measles vaccine was introduced in 1963, the virus sickened an estimated 3 to 4 million Americans each year and killed thousands, hundreds. Thanks to widespread immunization, measles was declared eliminated in the United States by 2000. Growing up in the early 2000s, my classmates and I never had to worry about outbreaks of reemerging diseases, shutting down our ability to attend, learn, and play at school. But today, vaccine exemptions are on the rise, and with them, the return of preventable infectious diseases we once defeated, like measles. Just this year, 2 school-aged children died in a measles outbreak in West Texas. That brings the national total to 3, and equaling the combined number of U.S. measles deaths in the past 25 years. A choice not to vaccinate isn't a risk-free choice. It's a choice to take a different risk, and this is what that risk looks like. The greater the number of exemptions, the higher the risk of outbreaks. The children who suffer most from these decisions aren't the ones making them. They rely on us, parents, scientists, doctors, and lawmakers to protect them. Every child's death is a tragedy, but when it's preventable, it's far more than that. It's a failure of policy, of responsibility, and of compassion. I urge you to vote against HB 1586 for the sake of our children and the health of our state.
Bless you.
Thank you.
All right, ma'am, are you on the end?
Thank you. Good evening, committee. My name is Becca Harkle-Rode. I'm a nationally certified school nurse and the executive director of Texas School Nurses Organization, and we're in strong opposition of House Bill 1586. You know, it wasn't until I became a school nurse that I realized it never occurred to me that vaccines could be so controversial. Because to me, they're just as important to your child's health as teaching them how to wash their hands, brush their teeth, eat healthy food, and get enough sleep. But I understand parents have questions, right? I mean, a child is a parent's most precious treasure. They're gonna have questions. They're gonna question everything. So when parents came to me with questions, I was always happy to sit down with them and have those conversations and help them make informed decisions. As a school nurse, I don't want to take away parents' right to choose. As we were mentioning liberty earlier, we don't want that right to choose to be gone, but we need to make sure that non-medical exemptions are being submitted for those reasons. This bill is not just about a form. This bill makes it easier to obtain an exemption than it does to get a vaccine. And until we're talking about access in our rural areas, making it easier to get an exemption than it does a vaccine is no longer about just a form. It's about changing this from a reason of conscience to a reason of convenience. The system that is in place works. It's not too arduous or laborious or prohibitive for people to start school, as we've heard conflated quite a bit throughout this session. The current process works. If it didn't, we wouldn't be seeing vaccine exemptions on the rise, such as they are. I really think that we need to keep the process as it is. I really was in support of the bill that you proposed, Senator Hall, that would allow provisional enrollment for people who could show proof that they had already filed for their exemption to be brought to them in the mail. It made sure that that was still a decision they
You
were
need to wrap her up.
All right. Thank you.
Thank you. Appreciate it. Members, any questions? Senator Hall.
Yeah. How confident are you that vaccines actually work?
How confident am I that vaccines actually work? I am 100% confident that vaccines work. That's not to say that I'm 100% confident that vaccines work 100% of the time to prevent anybody from ever getting sick.
So why would you be concerned about someone who did not have a vaccine? If you're vaccinated, why should you worry about someone who isn't vaccinated? Because you're vaccinated, you're not going to get it. So what threat are they to you?
Well, vaccines work by the concept of the more people in an area who are vaccinated, the less chance there is for that virus to spread or that disease
But if
to
you're
spread.
vaccinated, what difference does it make whether it's there or not? Either the vaccine works or it doesn't work. And why is a child who chooses not to be vaccinated any more of a threat than the child who cannot be vaccinated for medical reasons? That you accept their reason, medical, why is this child more of a threat than that one?
Because the child is not choosing not to be vaccinated. The
No,
child's parent.
That's not the answer to the question. That's not answering my question. My question is why is this child more of a threat than that child?
Yeah, the bill's about the forms and access through forms and making the process more convenient in the term. So that's a different debate for the day for the biologists and medical technicians. So any other questions for the panel? Senator Cook.
Thank you, Mr. Chairman. Just to respond super briefly to that too, there's a lot of factors with medications, vaccines, bioavailability, how long things last. There's different types of vaccines, different types of viruses. There's dose response type stuff. So when you're looking at population protection, you're looking at like bell curves. It's not 100% one thing or the other. But I've got a couple questions, Reka, if I could ask you. How does this bill have the potential to impact the rights of kids who have a medical need to be exempted?
Well, I mean, obviously, children who have, are medically contraindicated, they're at greater risk because, again, as Becca had mentioned, when there is a correlation between exemptions and outbreaks. The more people who are exempted out of vaccines, then the higher the risk of the outbreaks. And the concept of herd immunity, where we need to have a certain percentage of the community vaccinated or protected against these diseases, helps kind of act as a shield. And so for those children who cannot be vaccinated, we kind of have a responsibility as a community to make sure that we achieve those high vaccination rates in order to protect those people, those young children, those older individuals, people like my mom who has who's immune compromised, who's on biologicals, who's medically fragile herself, to make sure that there's enough protection in our communities so that they don't fall sick.
Thank you. And Becca, I don't know if you can comment on, normally if you request this form, and I know that informed consent is a high priority of this committee, and it makes a lot of sense. Normally when you would request this form, they would come with information. Is that correct? Information about the risks of being vaccinated or not being vaccinated?
I can't answer that question because I've never received those forms in the mail, but I was about to say, I think Ms. Schlegel could probably tell us what comes with it, the benefits and risks of vaccination. I know that's required.
So I think in the same way as when you go to a doctor's office and they should share with you risks and benefits, when you're looking for the exemption, DSHS is then also able to provide some risk and benefits. So if we just are downloading this form, or if people are handing out this form to each other, I am concerned. Are y'all concerned that people might not have access to the risks of not vaccinating?
Yes, absolutely.
I do have a question about 75% of Texas Medicaid enrollees are children. So in the event of another infectious disease outbreak, are we concerned about how this might impact our state spending on Medicaid?
I mean, again, when you look at the cost of outbreaks, I mean, I have not seen, what the current cost of the measles outbreak response is. If you look at other responses, like for example in 2019 in Clark County in Washington State, I mean, the average cost of one measles case was about $47,000. We're up to, I think, what did I have? 722 measles cases so far. So we can guesstimate that we're running into millions of dollars. And again, as we continue to see exemption rates increase, we increase that risk. And this is a very poor analogy, but think of it as like warm ocean waters. For us who live in Houston, we're always worried about hurricanes, and those warm waters just create a prime ripe situation. That's exactly what we saw respectfully in Gaines County. Gaines County has consistently had high exemption rates. It's not going to happen today. It's not going to happen tomorrow. It's going to build over time. So those warm waters have increased and increased, and now this is the fire that we're seeing in Gaines County.
Thank you. And I've just got 2 more questions to this panel. Y'all know this is near and dear to my heart. This committee has on other bills kind of made a distinction between vaccines that are newer to the market and vaccines that are time tested. This one's been around, I think, since the 60s. The FDA, the CDC, DISH's, the Trump administration have all basically said that childhood vaccines, especially the measles vaccines, all those and the kind of time-tested ones are safe and highly encouraged. Do you see this bill making any sort of distinction, or are we lumping in even the most tried and tested vaccines now?
Well, I mean, obviously, this bill pertains to the current school-required vaccines. So those are things like, MMR, and so on and so forth. And so again, I mean, exemptions are exemptions. I mean, we're looking specifically at the current school-required vaccines, but over time, if the department, if the legislature, sees that additional vaccines need to be required for school, then obviously those are going to be factored in as well. I don't know, Becca may have some additional perspective.
Thank you so much. And then I don't know if you've had a chance to see the committee sub. I think Section 2 got added. It just talks about prohibiting a healthcare facility from rejecting for any reason exemption based on reasons of conscience, including a religious belief. I've had coworkers that had religious exemptions for vaccines and worked with a mask and that sort of thing. But do you have any comments just about healthcare facilities and vaccines in those settings?
I mean, I would just say, we believe that, the healthcare facilities, should have the ability to set whatever health and wellness and safety policies.
And again, we'll get back to the exemption request on the forms and the whole vaccine conversation that till ad nauseum we've had this session, last session, and the session before that, and session.
Most definitely.
It's not about any of these conversations that are ongoing. It's about a form, and I think we're about done.
But sorry, Senator Perry, this in the committee sub, it does have.
I appreciate it, but
okay.
It's 9:30. We've got another at least 4 hours.
Gotcha. Thank you. Thank you so much.
Thank you. All right.
Thank you, Mr. Chairman.
Appreciate it. All right, that's it. Anybody got any other questions for this panel? Thank you guys for hanging in here today. I need to call up, I believe it's Barbara Ragnovsky and Judy Powell. Is there anyone else? I have not called to register on for or against House Bill 1586. I don't have anybody else but these 2 individuals, Barbara Ragnovsky and Judy Powell. If there is, get them in there. Okay, Judy Powell? Is that you, Judy, or Barbara?
Sir?
Are you Judy or Barbara?
I'm Barbara.
You're Barbara. All right, so we're missing Judy. Judy's not here. Go ahead, state your name, who you're with, position on the bill in 2 minutes.
Thank you kindly.
You're good.
I'm a wife, mother, and grandmother. My husband's an Aggie, proud Aggie. Our children, our Texas grandson and I are products of Texas public education. I graduated U of H and UT Law. I spent my legal career at Vincent & Elkins, spanning the 70s through the 2000s. Since then, I've taught peer mediation in public and private schools. Our 3 living generations were all vaccinated as soon as possible. There were tragedies in our lives. My great-uncle Lou, horribly crippled by polio, I'll never forget it. Since then, however, none of us in our extended families and no one we knew from school ever caught any of those dreaded diseases and crippling diseases that our ancestors feared and caught. The reason? Society, a clear societal understanding from active and living memories of the horrors of these deadly diseases and our role in society to help. We were taught it was our role in society to help, not maim or kill others. It was a golden rule. This bill, in my opinion, makes easy and convenient a parental choice which should be seriously made and could seriously affect many people's health and lives without hesitation, without thought or effort. And let me add, I have filled out many forms for children over the years, lots of years for public education. A parent making a life and death decision is not unreasonably burdened by obtaining a form, in my opinion. Our understanding of society and science is being harmed, in my opinion, by proposing to make easier and even more convenient a parental choice, which could seriously affect many people's healths and lives with no hesitation, no thought, no effort. I'm not saying people are acting intentionally when they do it. I'm saying they don't take the time because they're filling out so many darn forms. This bill proposes an amazingly convenient way, extraordinarily convenient. It's going to let parents never have to consider the illnesses they may bring upon their own children or their schoolmates. The consequences won't occur to most parents until the children they know are sick or
Need to
dead.
wrap it up. There, what is your actual position on the bill? I don't know that I got it. For, on, or against it? Are you for, on?
I'm against it.
Okay, I just need to
With
hear
all due
that. I don't
respect,
know
I'm
that.
sorry, I should have said that.
No, I didn't hear it. I just want to make sure.
No,
You're on the record. All right, any questions for this highly energetic and exciting personality to be here this late? So,
Sir?
highly energetic and
Well, I
entertaining.
kind of feel strongly.
I hear you. I appreciate it. Any questions? Thank you for hanging in there. Thank
Yes,
you for
sir.
being here. Appreciate you. Is there anyone else wishing to testify on, for, or against House Bill 1586? Hearing none, public testimony is closed. I can't believe that's my job. Where'd I get paid? She was high.
The chair lays out House Bill 1403, and which is being sponsored by Senator Middleton, but recognizes Senator Sparks in the absence of Senator Middleton to explain the bill.
Thank you, Madam Chair and members. HB 1403 is a companion to Senate Bill 1524, which this committee voted out earlier this session. As a reminder, this bill protects the privacy of foster families by prohibiting the Texas Health and Human Services Commission, the Department of Family and Protective Services, and child placing agencies from requiring disclosure of specific weapons, including firearms, or updates about changes in ownership. If such information is obtained, it can only be used to confirm the presence of weapons, not for any other purpose. This is a privacy measure, not a firearms policy. It's about the rights of foster families who dedicate themselves to providing safe and loving homes for children. With that, I'm happy to try and answer any questions.
Members, any questions?
Madam Chair, I'm so sorry.
Yes.
I know you're not the author. I just want to remind everybody that we did have 4 firearm-related deaths on the last DFPS report for children, and that the very comprehensive questionnaire that potential foster parents answer asks about things like butter knives. So it would be kind of wild, in my opinion, not to ask about firearms, but I just wanted to add that.
It's not saying that they don't ask about firearms. It's making that specific that that's the only reason that they can use that for is to determine are there firearms in the house.
Sorry, we have buzzer problems down here, so we're working some things out. So this is similar to the bill we passed out?
Yeah, yes.
Right.
I think it's the same bill. That's what it's a companion to Senate Bill 1524.
Okay. Members, any other questions? The chair, we have no one registered to vote. or to testify. So, members, with that, I'm going to ask, does anybody else want to testify on House Bill 1403? Hearing none, we will leave this bill pending at this time. Members, we heard House Bill 3284 earlier today. As a matter of pending business, the chair lays out House Bill 3284 and opens public testimony. At this time, the chair calls Carl Caton, Cassette Bowles, Aiden DeLaura, Sarah Beck, and Sarah Ramirez. Thank y'all for staying here all day.
You've been here as well, right?
Where are you from?
I'm sorry?
Where are you from?
New Braunfels.
Thank you. At least you don't have a terrible long way to drive home.
Yeah, it'll be
Again, I'm going to call those names out. I have Carl Caton, Cassette Bowles, Aiden De La Rosa, Sarah Beck, and Sarah Ramirez. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Thank you. My name is Carl Caton. I'm here for 3284. I lead the San Antonio Marriage Initiative as a volunteer. And I've been coming to the Capitol for about 30 years and to just encourage family policy. And I just want to say I've never seen a bill I'm more excited about. I'm excited because I think this will make it to the finish line, but I'm also excited because I think this could create really productive change in our state. A positive short-term outcome is that the committee would benefit the legislature, could bring a whole set of policy ideas, model legislation, research, and best practices from around the country. I've been all over the country seeing what states are doing, some really marvelous things happening in a lot of states. In the long term, the state could become more strategic in how we serve families, to become more proactive in our approach with families, and ultimately reduce the number of types of interventions that the state has. And in other words, Texas could play its best role by serving families and engaging them with them more often before they enter the system. We can design better ways to serve first responder families, military families who have an 80% divorce rate, by the way, foster families. Senator Sparks, thank you for serving them. They're overwhelmed with lack of capacity. And I'll just wrap up. As a fifth-generation Texan, I'm so grateful for all of you. Thank you for staying here tonight. I hope a commission would get you home earlier to your families, but also that it could begin work in the interim to give you a head start on making Texas the best state in the country to raise a family. Thank you.
Thank you. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
My name is Cosette Bowles, and I have a master's in marriage and family. I've been in private practice, marriage and family, for over 20 years. And 20 years ago, I formed Anthem Strong Families, originally Alliance for North Texas Healthy and Effective Marriages, Anthem. So that was legal. It got tiring writing that, so we changed it to Anthem Strong Families. I've been married 40 years. Everybody told me there were some bad days. Nobody told me that there were some bad years. But we're about to be 40 years, and I have been on the board of NARMI. We have had 20 years, over $30 million from the feds for fatherhood and healthy marriage and relationships, and a whole lot of work going down over about 60,000 people. I was involved with Arlene Wilgemuth, with Warren Chisholm, and with that group who got pushed through years ago, HB, I believe it was 2685, there was 83 and 85, where we had the Together in Texas group. We were picked as one of the intermediaries, but before that, walked with them, talked with different people, met, testified at different places to make that bill come true, with that thought being that we wanted to produce something that was helping with healthy marriage, with family formation, and healthy children. Again, all part of that. So since that time, we've been working, again, for 20 years in Anthem Strong Families out of Dallas, Texas. There is no discussion that healthy families are a key component of raising children who can make the mark of marriage. We talk about the success sequence in my business, which is very true, but I want to say that if we're going to hit the mark of healthy marriages, we mean healthy, not just pieces of paper, because how kids look at it these days is, why do I need a piece of paper when all I have to do is stay with this guy and tell him I'm out of love with him, and then stay with that guy, and on and on and on. So putting together something that is going to hit the mark is going to be a strategic plan. It can't be about divorce. It can't be about having people stay together in marriages where there is abuse. That's absolutely, absolutely not going to work. But there's so much work up to that point to get a healthy human being who knows what it is to be an adult in a relationship. Hard enough. And after that, what happens is that we have communities that are integrated, that are working to put together a different look on what family is about. We have so many things hitting it, a lot of fake news, a lot of things that go on these days, but we need these healthy families that can form and create communities that change kids.
Thank you. Thank you. I know our buzzer isn't working down there, so it's hard for y'all, but we're limiting. We still have a lot to go tonight, so thank you all so much for being here.
Thank you.
And staying. The chair calls Rye Vasquez, Morgan Whetstone, Michael Hiller, Matilda Miller. It's Michael Hiller and Matilda Miller. Sophia Murto. I'm going to call one more, Valerie Vaught. We will start on this end and we'll work our way around. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Hi, my name is Matilda Miller. First, I have a clarifying question. This bill mentions clergy. Is there a legal definition for clergy members?
It's not my bill, we'll find out. So keep going.
All right. Well, if a clergy member is not under any sort of accreditation process, then that just tells me that there is essentially no standard for one of the possible people who could be on this committee. And if they are accredited, then it needs to be ensured that there is some way that it does not violate the Establishment Clause to appoint a clergy member to one of 7 positions on a commission that will exist for less than 2 years. Now, let me tell you what I see when I see this bill. I see a state that has soared in maternal mortality by at least 30% after banning abortion. I see a state where only 2.5% of rapists actually get convicted. I see a state where it costs at least $5,000 just to give birth. I see a state that has not accepted additional Medicaid funding under the ACA when 48.8% of births in Texas are covered by Medicaid, 8 points above the national average. I see a state that has not raised the state minimum wage over the federal minimum wage in my lifetime. I see a state that has disempowered workers with right-to-work laws. I see a state that has done nothing to curb the skyrocketing cost of renting or buying a home. I see a state that has defunded public education over and over and now is set to deal its worst blow yet with the voucher scam pushed by Abbott and his donors. I see a state that would rather jail and deport immigrants than let them live, work, and raise families alongside us. I see a state that drowned a pregnant woman in the Rio Grande with razor wire. And now that state wants to form an entire commission to ask why people don't want to get married and start families here? You've tried nothing and you're all out of ideas? This bill creates an extremely partisan commission, as all members will be chosen by Abbott, Patrick, and Burrows, all hardline Republicans. You can claim all the livelong day that the goals not explicitly stated in the bill are irrelevant, but believing that would be about as foolish as not worrying about Elmer Fudd appointing every member of a commission on wascally wabbits. So what does the official Texas Republican Party platform say about the goals of this commission? Item 185 of the platform states that the Republican Party's only acceptable definition of marriage and family is heterosexual couples with children. Item 189 is to rescind no-fault divorce. That would certainly reduce divorce and increase two-parent households, as this bill explicitly states is part of its goals, all for the low cost of trapping women in abusive relationships as they were before no-fault divorce became law. How could a commission appointed entirely by Republicans be trusted not to push such a homophobic and misogynistic view of family? The intent of this commission is clear, and it is not to help families. It is only to serve to help propagandize, trick, and coerce the people of Texas into making more white babies. Do not advance this bill.
Thank you. I think I have your answer on clergy. We do define it in law, and Texas Rule of Evidence, Rule 505 definition in this rule, and it goes through what a clergy member is. So there is definition on it. I wanted to make sure I clarified that for you. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Thank you, Chair. My name is Rai Vaz. I am against this bill. I'm testifying for myself. Do you know the leading cause of every single divorce? Marriage. 100% of divorces happen because people get married. Look, I get why a conservative government would want to pass a bill like this. I even get why the bill is bipartisan. It's an easy win in the column for both sides to say, I support family values, while thinking this committee will do nothing. Party politics aside, we don't need to spend tax dollars on this. The commission will be helmed by appointees from the governor, lieutenant governor, and speaker of the House of Reps, making it heavily skewed to the one party in power. Why tout this as a bipartisan initiative if the entire board will be controlled by the dominant political party of Texas? Why not have the elected members be nominated by both parties evenly, majority and minority? I know you have provisions to vet candidates, but has that stopped the dominant party from pushing through people they want on these committees who are horribly unqualified? Also, why include clergymen in this committee? Is it all people of the cloth or only Christian ones? What guarantees can you make that will ensure the separation of personal religious beliefs from this commission? I know we've been skewing that line recently, but I'm pretty sure separation of church and state still applies. I don't want to live in a state that tells me I should get married when I can't afford my rent. I don't want conservative values of raising 40 children and working until I'm 80 to be the only things I'm good for in this society, to feed the machine of capitalism with sweat and fresh workers to replace the old and dying ones. We all know what the alleged findings of this report will be. It'll have one of two outcomes: a true scientific study with data and facts that Republicans will ignore because the liberal woke mind virus infected the results. Or the report will be highly partisan in favor of conservative ideals, of which will prop up the next legislative session's slew of bad bills to restrict marriage and family behavior. Don't make this commission and don't support this bill, not until you can ensure that it's truly bipartisan.
Thank you. If you would state your name for the record.
Yes, my name is
Bill.
Michael Hiller, and I'm in favor of the bill, and I'm here representing myself. I am a board-certified family lawyer, and although I understand there are a few others out there who do what I do, who support marriage, it doesn't really feel like that in the 35 years I've been practicing. So politics aside, being on the front lines in court almost every day. Yesterday I was in Houston. A few weeks from now I'm going to be in North Texas. I'm mostly practicing this area, and I live in Austin. There are a lot of problems in the family courts, and that's obvious from the time I walked into a courtroom over 35 years ago. And I just see family law as being a continuum, and we really should have input, and we should be involved in the health of marriages, not just the ending of them. And of course, the other part of it, and I've read the bill as much as I could, I just found out about it a few days ago. The other part of it is to encourage people to get married and to feel like they have an opportunity to move forward with raising children in a healthy way. And it really does come down, I think, to the children, and that's why we need to promote healthy marriage, whatever your politics are. If you see what goes on in family courts, how easy it is to get a divorce, and the fact that we don't have a waiting period, we do. It's 60 days, but it's very, very short. So I'm hoping to be involved with this commission. I'd like to be on it, actually, and to bring what I can bring to the table based on those 35 years of experience. Also, I'm married over 40 years, have 3 children from 33 down to 18. One's about to graduate high school. And I know what it's like. I know the challenge of raising children as well. And I look forward to helping this committee in the future. And I appreciate the opportunity to be here tonight.
Thank you. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
My name is Morgan Whetstone, and I'm here representing myself. I'm here to oppose the bill. For the most part, it sounds really good, other than the need for a member of the clergy, because if marriage is a religious ceremony, then the government shouldn't have any part in it. And then if it's a government standard, then it shouldn't have religious connotations, which is like a whole thing, but I'm not going to get into it. Other than a member of the clergy needed on the committee, and the appointers being people that I frankly do not trust, it seems to do anything that I would want out of a family planning committee. It doesn't specify the sex of the parents. It has competency as a qualifying factor for appointment, and they have the legal ability to criticize a lot of things that do make it harder for everyone, not just people who want or have families. But this bill misses a lot of steps that would make any committee so effective. I'm mad the writers got so close to the point and then whiffed it because what I suspect were Christian nationalists couldn't keep their fingers out of it. They say voting isn't a way to get exactly what you want, just about getting close enough that it's acceptable, like a bus stop. This bill is like a bus stop 3 blocks from your house, but Hitler's standing there with a machete. As it is, please vote no on it.
Thank you. If you would state your name for the record, who you're with, and you may begin.
Hi, my name is Valerie Vogt. I am here in opposition of this bill. I'm representing myself. And if we're honest, what this bill really does is it creates a commission to influence vaguely Texas law based on promoting strong marriage and families. But it's horribly clear who the people that would be on this committee would consider to be deserving of those families. Nowhere in this bill do you define what a strong family is, but you do fill the commission with clergy, political appointees, and people whose idea of healthy probably doesn't include single parents or anyone outside of your ideological mold. You're not just creating a commission, you're laying the groundwork for policy that targets families that you don't approve of, which really means protections for people who want to build families on their own terms. Texas doesn't need a government panel deciding whose love is legitimate and whose family is worth supporting. We need support for all families, single-parent households, chosen families, even without your approval. This bill isn't natural, it isn't harmless, it sets up a taxpayer-funded push to roll back hard-won rights on the guise of family values. Don't insult Texans by pretending this is just a study. We see what you're doing, and we will not let you do it quietly. Vote no on HB 3284.
Thank you. Thank you, panel, for being here tonight. Members, questions? Senator Hughes.
Thank you, Madam Chair. I think each witness, Counselor, I have a question or two for you. When you said you'd been licensed for 35 years, I thought, well, that's a long time, until I realized I've been licensed for 30 years this year, but I confess I don't have experience in family law, and you haven't, of course, you're not old, you've been at it for a while. At the time you began practicing family law, do you know, or do you recall, or if at the time for a divorce in Texas, there was still the requirement, or at least the encouragement, that the couple seek counseling, and historically, and again, this is a big debate because we want to make sure people are being protected, there's no abuse, but there's a big debate about how easy or hard it should be to get a divorce, and we'll continue to have that discussion. But what did that look like when you began practicing? If you can just give us a little idea about that.
So
it may not have changed much since then, but let us know, please.
But I'm sorry, I didn't catch the last.
It may not have changed much since then, but let us know if it has, please.
Okay, so briefly, okay, I come from a family of lawyers, so I've really been practicing since I was 4, because my dad was a lawyer and he was a law professor, so I've been around it my whole life. So I know more than my, as far as hearing about what things were like before I started practicing. And so, the stories of especially small town lawyers serving really as people that sat with their clients and realized that as each divorce happened, the community would begin to reduce its effectiveness. And so at some point, so I have never seen anybody talk about that as far as this is what they were doing in their daily life, except for maybe a handful. So no requirement for counseling. As a matter of fact, there is a statute that we have that says, it's very precise, and it's a very good statute, actually. It's what I would call a discernment statute, where the judge can refer couples to a counselor who then, I think it's like 60 days, to determine whether this couple has a reasonable chance of reconciliation. So we have a statute on the books, but I've never seen it used, except as far as I know. I brought motions for my clients and showed the statute to judges, and I had one judge tell me he's never seen this before. So, I mean, you never see anybody bring this kind of motion? No, I've never seen the statute. And this was a guy who was very involved in his own faith. So it just tells you how far we've drifted from the realities of how important. And it's not just marriage. Everybody here has the right to their opinion, and I don't know what else to say about that. It's just that when you're on the front lines and you see the harmful effects of divorce, when it shouldn't always happen. There was a rabbi that had a show called Shalom in the Home, and he wrote Kosher Sex and all this. He had a TV show, and he talked about you should never celebrate a divorce. There are no good divorces, but just necessary ones. So we all know there's abuse and all that, but as far as what you're saying, we should be instruments of helping people find ways to stay together. And for those, I would say the majority of people that call me now, they're not married and they do have children. And we should encourage them to find a way to provide stability in their home. I did want to say one other thing. I have been involved since about 2007, Arlene Wogemuth. It was Together in Texas, or Together Forever in Texas. But yeah, I agree with you. We need to bring that back.
Thank you.
Thank you. Thank you, Madam Chair.
Thank you. Members, if there are no other questions, this panel is dismissed, and the chair calls, where'd it go? Oxford De La Very, Juliet Thuber, and Vanessa Sivage. That is all that we have registered to testify on House Bill 3284. If you are here to testify on that and I haven't called your name, please make your way to the table. We will start on this end, and we will go around. Take your time.
Water real quick. Hi, my name is Juliet Thurber. I represent myself and I oppose HB 3284. Starting from the top, Section 1 is missing definition for the following terms. Lasting marriage. What is a lasting marriage? A marriage in which one party is trapped against their will by isolation, emotional, or financial abuse. Stable. What is a stable household? Where all physical and emotional needs are met. How about financial stability? Work stability. 2 parents. Does this have to be the original parents? What about remarried co-parents? What about adoptive parents or other family members who take on parental roles? Strong family connections and healthy family connections. What about considered strong? What are considered strong or healthy family connections? If biological family members are abusive or absent, where does a person's found family land? Texan. Who are considered Texans? Do they include people who are not religious, straight, or identify as male or female? Children. Do children include those that are adopted or those that one of the parents have physically given birth to? Clergy. What religious affiliation will the clergy be? Will it include Judaism, Muslim, Buddhism, Hinduism? Is having clergy members even necessary? How does this avoid violating the First Amendment? Continuing to Section 2, subsection 1, is it in the best interest of this state? According to whom? The 6 people who sponsored this bill? 15 if this committee decides to vote on this through? This bill will be using time and resources that may be used instead towards issues like finding placement for the 9,400 children who are currently in state custody, towards the 5,800 families who are currently in family preservation, Texas Department of Family and Protective Services, towards the 24,000 people currently experiencing homelessness in Texas, the 1,700 of whom are veterans and 5,100 of whom are unsheltered. I urge you to focus on finding solutions for these and that are current issues in Texas instead of the moral grandstanding that is trying to increase the birth rate and decrease the divorce rate until all meet Texans' need for shelter, food, health care, and safety for their families, regardless of what people make up those families.
Thank you very much. If you would, state your name for the record, who you're with, your position on the bill, and you may begin.
Ma'am, yes, ma'am. I'm Oxford de la Vie, and I oppose HB 3284, representing myself. The acronym CWAP, Children Without Placement, refers to minor wards of the state who sleep in government offices and other unlicensed settings under supervision of a rotation of caseworkers earning overtime pay because the state has no beds for them in a licensed facility or foster home. CWAP has been a known problem for at least 15 years. Add to this in the backdrop that 9 days ago, attorneys for foster youth have asked the United States Supreme Court to reinstate Judge Janice Jack's contempt order against the Texas state executive. Between fines imposed by Judge Jack and the well-connected lawyers that the state has hired to fight those fines, Texas has hemorrhaged money for this issue over the last 5 years. I would have thought that money would have been better spent finding beds for our children. I ask you to imagine, in this context, what happens when the governor's appointed clergy on this commission simply decide that same-sex couples are unsuitable for foster parents. CWAP populations only increase. Texas cannot afford to discriminate against viable foster families. This commission would attempt to increase birth rates, but Texas has a proven track record of being unable and/or unwilling to properly house the most vulnerable of its children. Furthermore, the commission would attempt to reduce divorce, but this bill makes no mention of addressing the social ills that cause both divorce and removal of children from the home: financial hardship, abuse, neglect, and addiction. Each of these is huge enough that it could easily take its own commission to solve. None of them can be prayed away by blurring the separation of church and state. My niece, raised by a single mother, is about to graduate Harvard on a full scholarship with a degree in neurobiology. That would not be possible unless her mother had correctly chosen her over her chronically unemployed, abusive, alcoholic husband, whom she divorced. Please stop this bill. Thank you for your time.
Thank you. Thank you for your words and your timing. It was impeccable. If you would, state your name for the record, who you're with, and your position on the bill, and you may begin.
Thank you. Thank you, Madam Chair and members. My name is Vanessa Sivich. I'm the president of Protecting Texas Children, testifying for our organization and myself in strong support of HB 3284. I am the product of loving and faithful parents who've been married for 34 years and raised me and my 4 siblings to love God, our country, and each other. Both of my parents immigrated from South America in pursuit of the American dream and are now legal citizens. And needless to say, I am deeply grateful for their sacrifice. I am immensely blessed and thankful for my upbringing, and my hope is that other children in the state of Texas would also experience what I did when considering the impact of what this commission would accomplish. President Barack Obama once said, "Children who grow up without a father are 5 times more likely to live in poverty and commit crime, 9 times more likely to drop out of schools, and 20 times more likely to end up in prison." Furthermore, data from the U.S. Census Bureau reveals that families headed by a single mother are 5 times more likely to live in poverty than families headed by a married couple. With this in mind, HB 3284 aims to establish a commission to focus on promoting strong marriages and healthy families, recognizing that stable 2-parent households are in the best interests of our state. Children from 2-parent homes are more likely to perform well academically, graduate from high school, and attend college. They also have lower rates of behavioral problems and are less likely to engage in criminal activities. Without a doubt, HB 3284 is an investment in the well-being of our children, the strength of our families, and the prosperity of our state, and we urge your support. Thank you.
You're welcome. Thank you. If you would, I know I called your name earlier, so if you would, state your name for the record, who you're with, and your position on the bill, and you may begin.
My name is Aiden De La Rosa. I am against the bill, and I represent myself.
Okay, great.
When I was reading the bill at first, on the surface, it looked good. Because I'm sure we can all agree, healthy marriages and supporting those who are raising children is important. Because we should be investing in the future of our country, which lies with our children. But the committee, as it's defined, does not invest into, as the previous testifier mentioned, that there are single-family households where they are more likely to live in poverty, and the commission focuses on 2-parent households. And because of the fact that it's trying to focus on both marriage and raising children, it would make more sense to focus on multiple different types of households to make sure that even if something happens, say one of the parents dies, right? So it's not a divorced single-parent household, the child in that household does not suffer those statistics.
Thank you. Thank you for coming forward to testify. Members, any question of the witnesses? Y'all are dismissed. Thank you for being here. We have no one else that's registered to testify on House Bill 3284. Last call for that. At this time, we will leave the bill pending before the committee. The chair lays out House Bill 1106 and recognizes its sponsor, Senator Hall, to explain the bill.
Thank you, Madam Chair and members. This bill came to us from the House Representative Shaheen. It makes a clear, common-sense measure by stating in statute that it is not considered child abuse for a parent or guardian to refer to a child by their biological sex, including the name that they were given at birth, rather than the child's preferred pronouns or name. There unfortunately have been instances where abuse was alleged against parents on this basis. When abuse is alleged against parents, subsequent trauma and cost is inflicted upon the family by the state and the court system. While this is sadly warranted in cases where the abuse is legitimate, we are not in the business of allowing this to happen unnecessarily. A parent choosing not to affirm their child's chosen gender identity may be difficult for that child. However, this ought not to be considered abuse or neglect, which are highly serious grounds. These allegations will almost surely lead to further damage for these children. With that, Madam Chair, I'd point out this, as I talked with the author on this, it was primarily aimed at giving guidance to CPS to protect the parents where children are claiming child abuse if the parents won't affirm their decisions to assume a different gender.
Members, thank you, Senator Hall. Members, questions of Senator Hall? Senator Cook.
Thank you, Madam Chair. And I know you're not the author, so I don't know, but has there been an instance of this in Texas?
There have been instances growing in other states, and this is being preemptive, of not just getting ahead of it, not recognizing there are other things that have happened in other states that grow and take on a life of their own. And so the idea here is recognizing and just step out and just saying what is probably common sense of recognizing parental responsibility and making sure. And we've had issues with CPS in the past of not knowing exactly what they ought to be doing and sometimes overreacting on things. And so just giving them guidance.
And I do remember in communities where I run in, it was a really big deal. The governor and AG, there's just a lot of commotion around parents who were affirming kids' genders. So does this bill work in the reverse? Like if a parent is affirming a kid's identity, expression, gender, that we guarantee that also won't be called abuse?
I don't see that in this bill.
Okay, thank you.
Senator Blanco.
Thank you, Madam Chair. Thank you, Senator Hall. I guess my concern is the potential chilling effect that it can have on those kids that who identify as LGBTQ. What would happen if, in a situation where one of those children were actually being abused? Those kids, what recourse would they have?
If they're being abused, then that is a totally separate issue. That's a totally separate issue. There were reports where children had called CPS in the past, and this happened a couple of years ago when I was involved with some of the stuff CPS was doing otherwise, and CPS reacted to it. They were claiming child abuse because their parent would not refer to them the way they wanted them to be.
Okay.
And so but if there's abuse, no, absolutely not. This is strictly aimed at the, self-identification that's different from their biological. And CPS not using that as abusing the child, just the reference.
Okay, thank you.
Members, other questions? So there are a number of people that have registered to testify, and we're going to call those. I know it's late at night, and some may have left from this morning, so I'll call and try to fill the seats up. We're going to start with Adesh Kerwin, Levi Kerwin, Sharmila Kerwin, Hayden Cohen, and Amanda McLaughlin. So we will start right here and we will work our way around the table. Are you ready?
Yes, I am.
Okay, great, super. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Okay. Name's Amanda McLaughlin. I'm representing myself, and I am against the bill. This bill is presented as a bill to protect children from abuse. The reality is the bill does the opposite. It subjects children to abuse. The bill assumes that being gay or transgender is wrong and harmful. I'm a transgender woman, and accepting who I am has brought me peace and given me strength to live a richer life. Some parents think that condemning gay or transgender children will cause them to give up and forget. Instead, what happens is a child's need to identify causes them to become hopeless and drives them into depression. Without hope, life becomes bleak. Suicide attempts by LGBTQ children are significantly higher than non-LGBTQ children. If even one adult accepts an LGBTQ child as they identify, they will reduce the risk of suicide attempts by 40%. Denying a person's identity does not change who a person is, but can lead to unhappiness and self-destructive behavior. Conversion therapy has been shown to be ineffective in changing people, but it can cause damage to a person that follows in the remainder of their life. LGBTQ people are documented all through history. You can try to erase this, but you will not succeed. Unfortunately, you can leave a path of pain and damage people. HB 1106 would allow parents to send their gay and trans kids to conversion therapy to misgender them at home and taunt them at home for their identity without any negative consequences. This bill does not protect kids. I thank you for listening. If you care about kids, I ask you not to advance HB 1106.
If
Good
you would
evening.
state your name.
My name is Hayden Cohen, and I am wholly against this bill. I grew up very fortunate to have accepting and affirming parents. When I came out to them as gay, their response was, I don't care who you marry as long as they're Jewish. Being able to grow up in a home where I didn't have to worry about being sent to conversion therapy or have parents constantly try and invalidate what I knew is true about myself made such a huge difference in my mental health and upbringing. Unfortunately, not all my friends had that sort of support at home, and it showed. Nobody's trying to say that accidentally misgendering your kid is abuse. What I am saying is that adults can have a serious impact on a kid's emotional health and well-being, and refusing to affirm your kid when they come out to you can have such a strong negative impact on their life. The American Foundation for Suicide Prevention blatantly does say that family acceptance and affirmation of one's LGBTQ+ identity is a factor in reducing suicide attempts and death. That's a fact. I won't say that by passing this, you're definitely killing queer kids. What I will say is that by passing this, you are absolutely harming them. You're telling them that it's okay for the adults around them to emotionally and mentally abuse them, but refuse to call it that. You're telling them that they don't deserve to be happy and grow up in a welcoming home like I did. And frankly, that's a really mean thing for my lawmakers to do, so please vote no on this bill.
Thank you. My mistake. I know y'all are invited testimony, and the author had asked, we usually honor invited testimony. My bad. So we'll start with you, and we'll work our way around, or whoever the three of you want to go first. Okay, great, super.
Sharmila Kerwin, I'm representing myself, and I am in favor of the bill. Madam Chair, Vice Chair, committee members, I testify in fierce support of HB 1106, not just as a concerned parent, but one who has lived through a nightmare. It is grievous to me, the need to codify common sense, yet here we are. This type of legislation would have provided the necessary bulwark to keep my daughter intact with her loving family. In 2020, our beloved 15-year-old daughter, Asha, shared she was trans. We did what we knew to love and support her, yet she had already been catechized. Arizona Department of Children's Safety, DCS, intervened and removed our daughter from our home. We fought back, and we were persecuted for our faith and our sound decision not to affirm a lie. In our every communication, we spoke truth, using her actual name and pronouns. Everyone surrounding her, the judge, a GAL, the CASA, attorneys, caseworkers, and therapists all affirmed her delusion, never once exploring root causes or practicing what is commonly known as watchful waiting. Everyone involved was trained or influenced by trans activists. We, her parents, were the sole voices of truth and reality. Our free speech and parental rights were violated while Asha was left to rot in decrepit foster homes. She was drugged out of her mind, all without family contact. Our relationship with our daughter was destroyed, and many heinous things happened. By God's grace, in August of last year, she called to talk. She shared she was no longer in DCS care, she was no longer trans, and she had weaned herself off of drugs, and that the research that her father had lovingly shared with her, that he was right. See what happens when the gender-affirming voices are removed? This is why this bill is important. Years of devastation could have been avoided had legislation like HB 1106 been in place. We know dozens of heartbroken families across America whose children have been removed because sensible parents want to speak truth to their beloved children. I ask for your support of HB 1106 to protect children and families. I thank you for your time and for your service to the citizens of Texas.
Thank you. Who would like to go next?
Senator Colkhorst and distinguished members of the committee. First, thank you for staying late and working your tails off. It's kind of gratifying to see how hard you work for us, so thank you. My name is Levi Kerwin. I'm the husband to my wife of 28 years, Sharmila. I'm father to Mikhail and Asha. We are worshipers of our Lord Jesus Christ. Radical trans activists, true believers of falsehoods, populate Texas DCS, or as it's known here, DFPS, and their subcontractees. We speak from experience, having lost our daughter Asha to these people in Arizona. Listen, our baby Asha was the delight of our home. A high-energy, wildly imaginative artist, dancer, and poet filled our home with peals of laughter and warm hugs. After she claimed a trans identity, age 15, we found a psychiatrist and a therapist. We found multiple counselors. They claimed they were practicing gender-affirming therapy, yet they had no answer for her self-harm, no ability to articulate goals for her healing, and she became angrier and more withdrawn. In September of 2020, Arizona's DFPS took our child. We were accused of emotional abuse and neglect for not supporting a trans male identity. Soon, they placed her in a group foster home where she saw a taxpayer-funded therapist. This person had her watch videos by transgender-claiming adults to, quote, choose her own trans-affirming family. This therapist later, with our tax dollars, had our 15-year-old mentally ill girl draw herself as, quote, the man she wanted to become one day. I quote from court records. We were dragged into court regularly, weekly in some cases, for years, but blocked at every turn from comforting Asha, from reconciliation, for her, and from exercising our fundamental parental rights. Before leaving our care, she was diagnosed in July of 2020 with anxiety. After, as you see in front of you, 6 months with Arizona's CPS, she was diagnosed with psychosis, major depressive disorder, recurring hallucinations, and drug and alcohol addiction. Parental rights laws are not themselves enough. Arizona has strong parental rights laws, ARS 601-1 and 601-2. Yet DFPS selects and employs caseworkers, therapists, and managers who believe the lies of gender confusion. Some of these will testify today. Activist judges and lawyers further create an impenetrable barrier between loving parents and gender-confused children.
If you could wrap it up with a sentence or two, I'm so sorry.
That's it. No, that's I appreciate it. It's happening in Texas. It's happening in Colorado. You're hearing it in the news, and that's why we're here. Gender ideology is not science. It denies anatomy, biology, and chemistry. It causes irreparable mental harm to the child and irreversible soul-deep damage. Please pass HB 1106. Thank you.
Thank you. If you could state your name for the record, who you're with, your position on the bill, and you may begin.
Hi there, my name is Mikhail Kerwin. I'm representing myself, and I'm in support of HB 1106. So, hello, Chair Holkhurst, Vice Chair Perry, and the other esteemed members of the committee. Thanks for staying out so late. Really appreciate it. I support HB 1106 because I lost my sister to government overreach in the foster system. So back in 2020 in Tucson, my parents had a disagreement with my sister over her belief that she was a man born in a woman's body. My parents didn't refuse the fact that she believed this, and they did nothing coercive in attempting to dissuade her of this belief. And as their son, I can personally attest to their gentle and patient treatment of my sister during this time. They loved her so much that they initially did what my sister wanted. They called her by her preferred names and provided her with binders to conceal her form. But later, my dad did some research, finding that medical affirmation and thereby social affirmation were in the long run harmful. He decided that affirming behavior would ultimately prove destructive to his daughter. So, my parents calmly pursued respectful dialogue with my sister concerning her gender identity, presenting vetted research and scientific facts that showed the destructive destination of the lifestyle that she desired. Despite my parents' love and patience, the state ultimately intervened and removed her from my parents' custody based on allegations of emotional abuse due to my parents' newly non-affirming posture. For this, they were slandered by caseworkers and by the activist judge who had presided over the dependency hearings. As they've already said, my sister was given over to drug use, alcohol abuse, and dangerous living conditions while in the foster system. She eventually aged out, and since then, her life has radically improved. She even renounced her transgender identity and cleaned up her drug use. Consequently, her mental and physical health have experienced a significant improvement since her departure from the unstable atmosphere of the foster care system. All in all, the state's involvement in my sister's life in just 4 years harmed her immeasurably. We know of families across the nation who have undergone different yet equally painful experiences due to state overreach, and I want to see an end to this in my lifetime. It is for this reason that I hope you will join me in supporting HB 1106. Thank you so much for your time.
Thank you. I have a quick question. This happened in 2020. Do you think that COVID and the lockdowns added to that her anxiety in July?
I thought about this a lot. My wife and I have talked about it. I think what contributed mostly was that it gave her a lot more time as an online citizen. We tried to lock down and only whitelist certain sites, but because she was in remote school through Arizona's, through the Vail School District where we were in, she had access through the internet, through an unfettered sort of, I'm gonna call it a wormhole that went through our whitelisting. And so she was using the school's own website to watch trans pornographic movies, as well as to connect with adults. And I didn't figure it out till 3 days after we took her and had her booked into the mental hospital in Tucson, which was 4 days before Arizona took her from us.
Do y'all live in Texas now?
We do. We live in Texas now.
What made you come to Texas?
The short answer is for work. Long answer is it was too painful for my wife and I to see the same sites in Tucson over and over again and know that we couldn't talk to our baby girl.
And your daughter is where now?
She's in Tucson.
Members, any other questions for the panel? Thank you all for staying. I know it's a late hour, and we appreciate your testimony and your coming to witness, all of you, for this bill or against this bill. Thank you.
Thank you. Appreciate it.
The chair calls Megan Fairbanks, Autumn Launer, Sarah Ramirez, Aiden De La Rosa, and Kelly Marshall. Megan Fairbanks, Autumn Launer, Sarah Ramirez, Aiden De La Rosa, Kelly Marshall. I'm going to call one more. Did I call your name? What is your name? I haven't called you yet. Sarah Beck. Sarah Beck? Sarah Beck with us? Well, why don't you come on up since you're here? I think you're registered. There we go. I found you, Oxford. You can take that middle seat. We'll start on this end and we'll work our way around. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
Good evening, Madam Chair, members of the committee, and thank you for the opportunity to testify. My name is Megan Fairbanks. I'm from Houston. I'm representing myself, and I'm here to voice my opposition to HB 1106. And for the record, I've been awake since 3 a.m. I want to tell you a bit about my childhood as it relates to this bill. I turned 18 in 1989, which means my childhood was a good number of years ago. From the day that I was born, I have literally never gone by the first name that I was born with. My parents instead chose to call me by a nickname. Somewhere around first or second grade, I asked to not be called by that anymore, instead opting to go with my middle name. It wasn't a big deal. In addition to that, every year when a new school year started, the teachers would call roll on the first day, and many of those teachers would ask, if there's something else you would rather go by, please let me know. And in every class, there were always a handful of us. Again, it just wasn't a big deal. Nobody cared. Why is all of a sudden legislation like this being put forth? Freedom and liberty are traditional Texas values. I had that freedom to choose how I wanted to be identified. We teach our children manners and to be polite. What message are we sending to our children with legislation such as this? Do as I say, but not as I do. Is that really the mindset that we wish to codify into law? Senator Hall, it's my understanding that your legal first name is not Bob, but that's what you prefer to go by. Senator Hughes, like me, you prefer to go by your middle name. I'd be curious to know how old both of you were when you chose to go by those preferred names. I would also hazard a guess that your peers in the legislature respect those preferred names, and whether I agree with you politically or not, I personally still choose to respect your preferred names. Madam Chair, when you addressed Senator Campbell earlier this morning, you said, Dr. Campbell, Senator Campbell, in a manner that suggested that you weren't sure how she would prefer to be addressed, presumably because you wished to be respectful of her preference. When we come into this chamber, we're expected to speak and act with decorum. I'm asking you today for similar decorum for all Texas children. I'm asking you not to move this legislation forward. Thank you for your time.
Thank you. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
My name is Aiden De La Rosa. I am against the bill, and I'm representing myself. I have personal experience with this, not in my own home, but having supported friends through this. I have two very close friends that I consider as close as siblings, really. One of which was disowned by her father when she came out as trans. And for the next 2 weeks after that happened, all of our friends took effectively shifts, making sure that she didn't kill herself. It wasn't until a couple years later that she finally accepted that she really didn't need her father's approval, and quote unquote healed, for lack of a really better term. The other one, his father wasn't directly, his father wasn't only transphobic against him. His father also emotionally abused him in other ways, and other forms of abuse that I will not name here for sake of respecting decorum. But the transphobia that his father exhibited was the push that almost sent this friend over the edge. And over the years, over the almost a decade that I've known this man, I have talked him off the proverbial ledge multiple times. Now, I understand that there is a worry of kind of overcorrecting, right? But it should be understood that these terms, these ideals, are harmful to children, and by restricting the ability to punish parents, or to punish this discrimination and the actions caused by these ideals, you will not only harm children, but lead them to higher rates of suicide.
Thank you. Thank you for your testimony. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Thank you. I'm Oxford DeLavier, and I oppose HB 1106, representing myself. The Family Code wisely defines abuse as causing a child to sustain mental or emotional injury that impairs psychological function. LGBTQ youth with at least one affirming parent in the home are about 40% less likely to attempt suicide. Shielding unsupportive parents puts those children at risk. This bill's language protecting a failure to affirm is broad enough that it invites compounded harm. Unlike 27 other states that have enacted full or partial bans on so-called conversion therapy for minors, Texas has no such protections. The American Psychological Association deems conversion therapy to be a violation of the Hippocratic Oath to do no harm. Many other medical and mental health organizations reject it as both harmful and ineffective. Moreover, about 35% of practitioners in Texas are wholly unlicensed. LGBTQ people subjected to conversion therapy are more likely to experience severe emotional distress, depression, illicit drug use, and suicide. I know several people who were electroshocked as children. They are still gay. They are also traumatized, mistrusting of mental health providers, and alienated from family. This is not a cure. It is punishment. It only serves to drive behavior underground, away from parental oversight. Please stop this bill. It does nothing to protect children. Thank you for your time.
Thank you. If you would state your name for the record, who you're with, and your position on the bill.
Good evening, committee members, Senator Cole Hurst. My name is Kelly Marshall. I'm testifying against HB 1106, representing myself and the National Association of Social Workers, Texas chapter. As social workers, we adhere to our code of ethics and moral values to uphold, support, and protect the dignity and worth of every human being. with the utmost integrity and competence available to us, especially when it comes to children's rights and youth. I'm also expressing opposition of this bill on behalf of my transgender community. I am speaking from the competence and the wisdom of my lived experience as a transgender person. My gender identity has been as irrefutable as my eye color my whole life, as much as yours has been. I did not choose it. And neither do the children who will be deeply harmed by this legislation. HB 1106 seeks to amend the definition of child abuse and neglect to exclude certain parental decisions and actions that do not affirm a child's gender identity and expression. In my work with children, adolescents, and families, I have witnessed firsthand the profound impact that affirmation and acceptance can have on a young person's mental health and development. Conversely, there is a preponderance of clinical evidence showing that the rejection or dismissal of a child's gender identity increases the risk of depression, anxiety, substance abuse, self-harm, and suicide. If enacted, HB 1106 would strip vulnerable children of the limited but crucial protections that currently exist under our child welfare laws. While we respect deeply the rights of parents, these rights must be balanced with the child's individual rights, autonomy, and basic needs for safety, validation, and caregiver support.
Thank you. If you could wrap it up with one sentence, what would it be?
Codifying non-affirmation as legally protected behavior sends a dangerous message that a child's identity is less worthy of protection, understanding, and care. Thank you very much.
Thank you. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Thank you. My name is Autumn Launer. I'm a transgender Texan and vice president of the Texas Transgender Non-Discrimination Scholars. I'm here today to oppose HB 1106 on behalf of our organization and myself. I come from a background in social work. I'm not a lawyer, but I am trained to recognize harm, especially when it hides behind respectability. I want to assume positive intent in reading this bill, and I do believe the authors care about families the same as me. Genuinely, I do. We just have a different understanding of care, and I hope you'll meet me in that spirit with what I'm about to say. Gender dysphoria is real. Whether or not we agree on the cause or treatment, it is recognized by every major medical and psychological association, and I can promise you from personal experience that it isn't fun. If a child with anorexia is mocked by their parents to the point of self-harm, we call that abuse. If a parent weaponizes a child's trauma and exploits their anxiety to cause distress, it's abuse. If a parent intentionally misgenders a child with gender dysphoria, not out of a deeply held belief, but just to cause that child pain, that is abuse. And when it's done to psychologically punish and emotionally torture that child, we call it what it is. It's abuse. Unfortunately, some people know exactly how to hurt children, and sometimes the cruelty isn't accidental. The cruelty is the point. I've tried to read this bill in good faith, but when a loophole this large is left open, it's hard not to wonder if that's the point. If the true goal is to protect children while preserving parental choice, then we need language in this bill that reflects it. Regardless of your politics or your beliefs about gender identity, no law should shield intentional harm to a child. This bill needs clear, enforceable safeguards that allow intervention when identity is used to abuse a child. My ask is that you vote no on this bill, but I understand this body, and if it's going to leave committee, at least make sure that it doesn't permit abuse by erasing the state's ability to even recognize it. Thank you.
Thank you. Members, questions? Senator Cook.
Thank you so much. I've got a question for our social workers on the panel. So I've worked a lot in homelessness.
Speak up, Senator.
Oh, thank you. I've worked a lot in homelessness, take care of a lot of patients who are experiencing homelessness. The LGBTQ population makes up almost half of homeless youth, right? Which is very disproportionate to our amount of people in the population. Sorry, it's late. Can y'all comment on anything that you've seen that leads to homelessness in LGBTQ plus youth?
I just want to state that there, again, is a preponderance of clinical evidence about the correlation between a lack of gender-affirming parenting and homelessness, houselessness. I would say locally, Out Youth supports a lot of youth that have been displaced because of that. And I can't speak to specific statistics, but it is very, very high. I would say at least in the 80 to 90%.
Thank you so much.
Thank you. Appreciate y'all being here tonight, staying in this late hour. I know it's been a long day, so we appreciate your input. Y'all are dismissed. The chair calls Mandy Giles, Rai Vasquez, Morgan Whetstone, Nathaniel Reed, Paige Schilt. Again, Mandy Giles, Rai Vasquez, Morgan Whetstone, Nathaniel Reed, and Paige Schilt. I think I can call one more, and Elsie Kendall. Elsie Kendall, join us at the table. We'll start here, and we'll work our way around. If you would, state your name for the record, who you're with, your position on the bill, and you may begin.
Hi, I'm Rai Vaz. I am against this bill, and I am testifying for myself. And sorry, y'all, but this is going to be a doozy. Republicans preach from their high horses that bills like these will save children, and yet when children or supportive parents come forward and say these bills will harm them drastically, you don't listen. You don't listen when we tell you that excluding language from these definitions of abuse will be more abusive to people. You don't listen to the experts in related fields who actually have credible data for you to reference that say the contrary. Heck, I will give it this panel credit. Everybody is here. But half the time we are testifying to ghost towns and we are waiting 15 hours to testify. Never have I seen a body of government so truth-phobic, so scared to listen to people screaming and bleeding in front of you. There are so many issues facing abused families in this state. The horrible statutes for intervention, i.e. when cops really can't do anything if an abuser hasn't physically harmed those who called emergency services. Systematic ignorance of abuse by neglecting to record events correctly or not believing in victims when they come forward. A huge lack of consequential reparations to abused people such as restraining orders or divorces. Gaping holes in gun laws that still exist where many abusers are able to buy firearms legally and use them to threaten and abuse their children or family members. All issues I faced from my abusive father even before I started identifying as queer. But trans people are the real threat. Parents can do whatever they want to their offspring, send them off to electroshock therapy, beat the gay out of them. Heck, it's even within parental rights to abandon a child and leave them destitute, unable to feed themselves or find shelter, so long as they die on the streets as a homeless queer and not aborted, right? Stop passing bills you know are bad for your constituents. Nothing's in these bills stop any abusive parent from lying and saying they inflicted horrible pain on their child because of the exemptions you will create in this bill. As a survivor of parental abuse, I will not sit idly by while you embolden a whole breed of bigoted abusers to cause harm to their children simply because you want to fix your little trans issue.
Thank you. If you would, state your name for the record, who you're with, and your position on the bill, and you may begin.
Morgan. My name is Morgan Whetstone, and I am opposing this bill, and I'm representing myself. There is a Murphyism called Hanlon's razor, and it is stated as this: never attribute to malice, which can be adequately explained by stupidity. And when I look at HB 1106, I don't know which one to attribute to the creators of it, or anyone who would vote in favor of it. I personally would be ashamed to have my name positively associated with the bill that says, as long as people bully children the way I want to, it shouldn't be abuse because I'm a good person and I say so. That should be deeply embarrassing, and if you don't think so, then maybe you should take a step back and examine your behavior. Thank you.
Thank you. If you would, state your name for the record, who you're with, your position on the bill, and you may begin.
Right. Hello, I am Nathaniel Reed. I am testifying of myself, and I am testifying against this bill. Parents of transgender children are not failed parents. It has nothing to do with the parents or any external stimuli. Their children are wired differently. Parents who refuse to recognize this are in denial, as has been proven time and time again by science that sexual orientation and gender identity are innate characteristics of people. When parents put their children into conversion therapy, it doesn't make their children heterosexual or cisgender. Conversion therapy traumatizes children, destroys their self-esteem, and creates mistrust between them and their parents. Parents who refer to their transgender children by dead names and cisgender pronouns won't magically make their children cisgender. It may put them back in the closet, but it won't fundamentally change who they are. Parents should take time to understand their child, treat them with dignity and respect, not become their first bullies. This bill would legitimize parents psychologically abusing their children simply because their children don't follow societal norms, and as a result could lead to more children engaging in acts of isolation, self-harm, and suicide. This bill isn't about parents' rights or religious freedom. It's about pushing an agenda of irrational hate. As a neurodivergent person, I sympathize with transgender youth. They are mistreated for being different, just as I have been mistreated for being different. I personally know many transgender youth who dealt with abuse, have gone homeless. If you care about the mental health of children, I ask you to vote against this bill.
Thank you. Thank you for your testimony. If you would, state your name for the record, who you're with, and you may begin.
Yes,
Position.
my name is Elsie Kendall. I'm representing myself, and I'm here in opposition to HB 1106. So in here I have good morning. Obviously, it is well into the evening, so good evening, Chair Crocors, Vice Chair Perry, and Health and Human Services Committee members. It is not my belief that guardians are incapable of loving their child if they do not understand trans or queer identities. One of the biggest role models in my life used to reiterate to me how gay marriage was unacceptable. They always had something negative to say about queer and trans issues, even if it wasn't brought up. These negative comments ultimately delayed the coming out process for me until adulthood, because I didn't think I was worthy of being loved as being queer. I am not the only child who has experienced this. In fact, due to lack of fears of acceptance, 1 in 7 trans people are not out to their families. These fears are not unfounded, as only 1 in 3 LGBTQIA+ children live in LGBTQIA+ affirming homes. Now, I am one of the lucky ones. With some explaining and growing, my biggest role model turned into my biggest supporter and began to love me as I am. As long as a non-affirming guardian does the work to learn how to support their child and does not abuse their child, they face no threat of losing custody at this moment. HB 1106 isn't needed to protect the guardians in that situation or in cases like mine. In fact, opposition to HB 1106 is critical to protecting LGBTQIA+ children. We cannot afford to hope that all non-affirming guardians will grow to love their children for who they are, especially when trans children are 60% more likely to face abuse at home. This is why child protection laws exist. They are designed to protect the best interests of the child, not abusers. I want to thank you all for allowing me to testify today. I urge members of this committee to vote no on HB 1106.
Thank you. Thank you for your testimony. Perfect timing, actually. Thank you. If you would, state your name for the record, who you're with, and your position on the bill.
My name is Mandy Giles. I'm representing myself, and I'm testifying against HB 1106. When my child came out as transgender, I didn't understand. I had doubts, questions. I didn't know if it was real. I didn't use their new name at first or their new pronouns because I didn't know any better. But then I learned that parental support is the #1 protective factor for transgender youth, and that I didn't have to understand everything to be supportive. and then I did better. I also learned that refusing to affirm my kids' gender identity or use their chosen name and pronouns could cause them irreparable harm. Study after study has shown that family acceptance of transgender and non-binary kids predicts greater self-esteem, social support, school belonging, and general health. Family rejection and even indifference has been linked to increased likelihood of substance abuse, suicide attempts, and overall psychological distress in transgender youth. This bill allows those negative outcomes to happen because it protects parents and guardians who are actively harming transgender kids. The real issue in Texas is that parents who affirm their transgender kids are being accused of child abuse. I have literally lost count of how many families I know personally who have moved out of Texas to protect their transgender kids and their families from our state government. It is heartbreaking. The quality of life for transgender kids is better when their parents accept and support their gender identities, and it's worse when their parents reject their identities. Please vote no on this bill.
Thank you for your testimony, and thank each of you for staying in this late hour to make your comments on this bill. Members, any questions for the panel? Thank y'all again. The chair calls Landon Ritchie, Matilda Miller, Gordy Carmona, Nathan Bashira, and Charles Soto. We'll also call Vanessa Savage and Rocio Ferraro Perez. Ms. Savage, we'll start with you, and we'll work our way around.
Thank you, Madam Chair and members. My name is Vanessa Savage. I'm the president of Protecting Texas Children, and our organization strongly supports this bill. In recent years, we've witnessed troubling instances where parents have faced investigations by CPS simply for not affirming their child's expressed gender identity. Many activists will claim that this never happens, but allow me to quickly share the story of Desiree Thomas, a Texas mother who, after declining a psychiatrist's recommendation to administer puberty blockers to her son, was reported to CPS for not providing quote-unquote medically recommended care. Her son had adopted a female name and pronouns at school and online, influenced by therapists, medical professionals, and school officials, promoting gender ideology. When Thomas mentioned her son's feminine behavior to his pediatrician, she was referred to a behavioral specialist who immediately prescribed puberty blockers, suggesting her son might transition. Thomas refused the prescription and removed her son from the situation. Subsequently, the psychiatrist reported her to CPS for not providing this medically recommended care. This should never have happened. HB 1106 directly addresses this issue by amending the Family Code to explicitly state that the refusal of a parent or guardian to affirm a child's sexual orientation or gender identity, or to address the child by their preferred name or pronouns, shall not be considered abuse or neglect. This clarification is vital to prevent the misuse of CPS investigations against parents who are acting in the best interests of their children based on their own values and beliefs. Protecting Texas Children supports HB 1106 as part of our mission to safeguard the innocence of every child by affirming biological truth. Our organization wholeheartedly supports any legislation that will strengthen the family by opposing harmful gender ideologies. Thank you.
Thank you. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
Good evening, Chair, Colhurst, and committee members. My name is Gordy Carmona, and I'm here representing myself in opposition to House Bill 1106. While this bill appears to protect parents who may not understand trans or queer identities, it is so broad that it allows for a wide range of risky, harmful, and dangerous treatments towards LGBT children. I don't share this part much in my life as much, but I had a very difficult childhood. My earliest childhood memory as a toddler is watching my biological father beat and strangle my mother. That memory was so traumatic that it was one of the very few childhood memories I can still remember. For the record, that is child abuse. Child protection laws are designed to protect the best interests of the children. This bill would protect abusers, not children. It is possible for queer kids to thrive in homes where parents don't fully understand their identity. This bill would allow parents to force their children to undergo so-called conversion therapy, an outdated and harmful practice that attempts to convert a child to be straight or not trans. Decades of research has illustrated the harms of such practices, and 22 states have banned this practice. We know that one supportive person in a child's life can have a massive impact on health and well-being of a trans or queer child. I am living proof of that. When I came out as queer to members of my family as a teenager, they supported me. While some of them may have had made some off-color comments, I knew that they loved me. I am one of the lucky ones. I could have just as easily been born into a family that didn't fully affirm me for who I am. No one is trying to force parents to accept any particular belief. We are simply asking that LGBTQI+ children be protected by this legislative body that claims to champion protecting Texas children. I strongly urge you to vote against HB 1106. A vote in favor is being complicit in that abuse.
Thank you. If you would, state your name for the record, who you're with, and you may, your position on the bill, and you may begin.
Good evening, Senators. My name is Rocio Fierro Perez. I'm the political director at the Texas Freedom Network, an organization of parents, clergy, young Texans, and people who support equality and justice. TFN strongly opposes HB 1106, and like most Texans, we believe in protecting families and creating safe environments where every child can thrive. We want our child protection laws to reflect our shared commitment that all children deserve to grow up free from harm and with the support that they need to become healthy, confident adults. The foundation of child welfare in Texas is built on balancing respect for parents' rights with our collective responsibility to ensure children's safety. When we look at what truly protects children, the evidence is clear. Children who feel supported, valued, and accepted grow into resilient adults. This is not a political statement. It is supported by decades of research in child development and mental health. All Texans, including LGBTQIA+ youth, deserve to feel safe, respected, and accepted in our state. No one wants a child to experience bullying, stigma, or shame in the very place that should be their sanctuary. HB 1106 undermines this careful balance by creating a dangerous carve-out in our child abuse definitions. By broadly exempting non-affirming behaviors towards LGBTQIA+ youth, this bill potentially shields behaviors that research has definitively shown cause serious psychological harm. This bill would allow parents to subject their children to practices like conversion therapy and deny them access to mental health care support during critical developmental stages, all under the shield of non-affirmation. True protection of Texas children means safeguarding all children, including those who identify as LGBTQIA+. Our values call us to recognize that protecting parental authority should never come at the expense of a child's well-being and safety. HB 1106 moves us away from this principle, placing vulnerable children at even greater risk. I urge you to protect Texas children by voting against HB 1106. Thank you.
Thank you. If you would, state your name for the record, who you're with, and your position on the bill.
Hi, my name is Matilda Miller. I'm here to oppose HB 1106, and I'm representing myself. First, I'd like to thank the invited witnesses earlier for demonstrating exactly the kind of abusive family that would be given carte blanche to abuse their kids even further if this bill advances. I could never fully articulate the kind of insane religious delusions, conspiracy theories, and outright hatred that would lead people to not only send their child to conversion therapy, a practice condemned by the UN as torture, but then come to the Capitol to whine that they weren't allowed to abuse their son more. I'm glad that he escaped, and if he sees this video, I am sorry that your family put you through so much, and that they then came here to speak on your behalf against your consent. Now I have to ask the members of this committee and the supporters of this bill, have LGBT kids not been through enough already? Before gay marriage was legalized, LGBT kids were already called sinful freaks, put through conversion therapy, as the invited witnesses confessed for us, and 40% of homeless youth are LGBT because their parents value hatred more than their own children. Then, after gay marriage was legalized, over the past decade, trans people have become the new scapegoat of the right, and trans kids were put at the tip of that spear. You banned gender-affirming care for youth last session. Abbott and Paxton tried to separate trans kids from parents who love and support them. The Republican Party has spent tens of millions of dollars demonizing them across TV and the internet. All of that isn't enough? You feel the need to secure a right for homophobic and transphobic parents to bully their own children. It's petty and small. You need to reopen pathways for conversion therapy? We know for a fact what is best for LGBT kids. The American Academy of Pediatricians, the authority on what is best practice medical care for children in the United States, has unequivocally endorsed that supporting and affirming LGBT kids is what is best for their health in both the short and long term, based on decades of peer-reviewed studies. That isn't an opinion or belief, it is a basic empirical fact. Now, I know that the idea of a kid being gay or trans probably seems alien and strange.
You could wrap it up with one sentence.
Rated LGBT
That would be
people.
great.
But you need to get over yourselves. Your mental barriers.
You're out of order. Thank you. Thank you. Thank you for being here tonight. I'm being a little lenient, but only by about 5 to 10 seconds because we have a lot of people that still want to testify. If you would, state your name for the record, who you're with, and your position on the bill.
My name is Landon Ritchie, and I'm the policy coordinator for the Transgender Education Network of Texas. I'm here in opposition to HB 1106.
And if you could lean into that microphone so we can hear you.
The date February 22nd, 2022 may not mean anything to you or to most people, but for parents of trans and gender expansive youth in Texas, that day was the first of many that it felt like the world was ending. That day, DFPS was directed by the Attorney General and the Governor to investigate families who affirm their trans kids for child abuse. No law or policy or statute had been changed to classify loving and supporting one's child as abuse. No, they issued that directive simply because they wanted to. Families began being reported by their neighbors, their churches, their kids' karate groups. Families whom even the Attorney General himself had broken bread with and who'd seen at firsthand how loving and supportive their homes were, received visits from CPS. These families did not feel safe anywhere. They expressed feeling like they were being hunted for sport by everyone around them, even their own families. The injunctions currently in place have provided some relief, but it doesn't negate the real harm and trauma experienced by real people. The looming threat of an investigation caused providers, including mental health care providers, to cease caring for trans youth out of fear that they and their practices would be targeted next. Families fled Texas, for some, the only place they'd ever called home, because they saw no future for themselves or their children in a state that constantly had its boot on their necks. And yet here we are considering a bill that protects and emboldens abusers rather than families who love and support their kids. Bills like this one are nothing more than ideologically driven extremist attempts to terrorize trans and queer kids. It grants parents permission to openly bully, harm, mistreat, and abuse their children without consequences simply because they are queer or trans. Texas should be working to ensure that all youth have every possible opportunity to thrive, not encouraging parents and guardians to bully their kids with impunity. A favorable vote is a wanton disregard for the lives of trans and queer youth. They deserve safety, respect, dignity, protection, and love too. And this bill sends the complete opposite message.
Thank you. Thank you. Members, any questions for the panel? Senator Cook.
Just a quick one. Thank you so much, Madam Chair. I was curious about Senator Blanco's question earlier about the chilling effect. So, Landon, I don't know. I know you've worked extensively in this area, but can you comment on, is there a risk that the complaints of gay or trans youth will be dismissed or overlooked as a result of this bill? Do you have any concerns about that?
Complaints of abuse
Right.
experienced by children?
Yeah.
I do think that is the ultimate result, or a very possible result, of what this bill will be. This essentially grants or expects a judge to overlook any instances of child abuse directed towards a child because they are queer or trans, but because that child is queer or trans, and because not affirming a queer or trans youth under the definitions of this bill would not constitute child abuse, then it is foreseeable that those instances would be overlooked, or a judge would be forced to, or not be allowed to take that into consideration when looking at these very individualized cases.
Thank you. Thank you so much. And I was just curious about the case. Was the child removed?
Yes.
Are you sure?
I need to look at my notes. I'm sorry.
That's okay. We can connect with it after.
Okay.
Thank you.
Thank you.
And that did happen in Texas?
Yes, it did. I can give you the source of where I pulled the story from.
Because I think Senator Cook had asked a question earlier in the layout.
I don't know of anyone being convicted of neglect, abuse, any child being removed as connected to this at all.
Sorry, I was just remembering. The caseworker went to the family's home, and the charge was dismissed.
Yeah.
So I was just trying to remember. I'm sorry. The child was not removed. The case was dismissed.
Yeah. Okay. Thank you.
It's only 10 after 11 on Wednesday night, so I know all of our, we're a little bit tired on our, thank y'all for being here. I appreciate it. Thank you for staying late. Jackson Vardson, Brad Pritchett, Sophia Murto, Miriam Lakey, and Valerie Vaught. I'm going to keep calling a few names here. Ash Hall, Aaron Walter, Michelle Matula, Venegas Matula, Carrie Holly Hurt, Erica Slaymaker, Carrie King, Francis Sepulveda, all right, we're going to go ahead. Juliet Thurber, Juliet here, Kit West. Juliet and Kit, join us at the table. Great. There's space on either side. While we're waiting for them to come, we'll start with you.
Good evening. My name is Miriam Lake, and I serve as the Government Affairs Director for Equality Texas, the largest statewide organization advocating for the rights of LGBTQIA+ Texans. I'm here today to express our strong opposition to HB 1106 and urge the committee to consider the serious harms this bill poses to the health and well-being of queer youth across Texas. This bill creates a dangerous and unnecessary carve-out in Texas's Child Welfare Code that directly threatens the safety of queer children. Decades of research show that rejection by family members can have devastating mental health consequences for queer youth. A 2009 study from the Family Acceptance Project found that queer youth who face high levels of family rejection were 8.4 times more likely to attempt suicide and 5.9 times more likely to suffer from depression. However, according to the Trevor Project's national survey on queer youth mental health, among youth who felt high levels of family support, rates of suicide attempts were less than half that of those who felt little to no support. By including this carve-out in legal protections, HB 1106 sends a chilling message to queer children that their identities are up for debate, that their emotional needs don't matter, and that they are not worthy of dignity or safety. It can also create confusion for educators, child welfare professionals, and mental health providers by making it harder to report or act on emotional and psychological harm rooted in identity-based rejection. Respectfully, this bill does nothing to solve real problems. There is no epidemic of children being wrongfully removed from their homes for being misgendered. What we do have is a crisis of queer youth mental health, distress, and homelessness. According to the National Coalition for the Homeless, up to 40% of homeless youth identify as LGBTQ, often due to family rejection. HB 1106 only stands to make that worse. We urge this committee to oppose the bill and instead work to protect all children in Texas, especially those most at risk for harm. Every child deserves to be seen, respected, and supported. This bill moves us in the wrong direction. Thank you for your time and consideration.
Thank you. Ash, you want to go next, and then we'll come back here.
Sure thing. My name is Ash Hall. I use they, them pronouns. I represent myself and the ACLU of Texas. We strongly urge you to reject this bill. 1106 is sharply at odds with the structure of the Texas Family Code, which does not specify or exempt any specific type of abuse or neglect. The definitions that it has are broadly written to protect young people in Texas, and there are no specific actions that are either prohibited or exempted from categories of abuse or neglect. HB 1106 would disrupt this framework and curtail the discretion of Texas courts and the Department of Family Protective Services in only one unique way: the refusal of a parent or guardian to affirm a child's sexual orientation or gender identity or use their preferred name and pronouns would be exempt from the definitions of abuse or neglect, no matter how bad the refusal is. At worst, some parents or guardians might think this bill allows them to completely abandon their children who are LGBTQIA+ and not face any repercussions. Already, 28% of LGBTQIA+ youth reported experiencing homelessness or housing instability in 2022, and parental rejection is the primary driver forcing these young people into poverty and homelessness. Specifically exempting only 2 potential types of abuse or neglect from future judicial scrutiny puts LGBTQIA+ youth at risk and distorts the family code into a weapon against them. In addition to being cruel and harmful, this bill is also unnecessary. There are no reports of parents in Texas being investigated by DFPS for not using their trans children's names and pronouns. To the contrary, the only parents of trans youth that the state of Texas has investigated are those who have supported their children's gender identity. DFPS has targeted these families despite medical opinion being unequivocal that gender identity is not a choice. Many people have clearly established gender identity that is different from the gender they were assigned at birth. Countless trans people thrive in our society and lead both ordinary and extraordinary lives, and there are at least 13,800 trans adolescents in Texas. Of all of the bills that we have heard in this particular committee together, I find this one to be the most egregious and harmful to youth. All of you, I'm pretty sure, know the definition, at least, of emotional abuse in this state. Everything that they are trying to exempt from this would constitute as emotional abuse. We can do a lot better than this, and we have to do a lot better than this. Our youth deserve better no matter how they identify.
Thank you, Ash. We'll continue along here.
Thank you, members. My name is Carrie King, and I'm testifying for myself against HB 1106. I am a cisgender female married to a cisgender male, and we have 3 cisgender children. So why am I here? I am here to support all trans and queer children and adults in this state and around the world. I'm here to advocate for the rights of children to be raised in a loving, supportive, and safe environment. We see what's happening. We see the unrelenting attacks and discrimination against trans and queer community members. We see the waves of anti-trans and anti-queer bills crashing through this legislative session. And despite this barrage, we stand strong, rooted in our resolve to accept and care for all. I cannot, for the life of me, understand the extreme xenophobia and intolerance that drives a bill like this. How long and how hard will we have to fight for the rights of trans and queer folks to simply exist? This bill will trap children who have no authority to advocate for themselves in a domestic abuse situation in which they're rejected and denied the right to their true identity. The natural instinct of a child pushes them to seek the approval of their parents and guardians in the interest of survival and self-preservation. It is not the task of a child to reject their entire sense of self to earn their parents' approval. It's the duty of parents to protect and provide for their child. To empower parents to wholesale reject their children so cruelly is heinous and unacceptable. As the daughter of a stereotypically strict Asian mom, I'm familiar with disapproval, disappointment, and criticism. There's really no worse feeling as a child to know that your parents wish you were different than you are. The pain and trauma is real. Trans and queer kids hurt no one. They shouldn't be punished. Strike this bill down and allow the experts to step in. Let's commit to protecting all children equally and compassionately. Thank you.
Thank you. Thank you for being here. If you would state your name for the record, who you're with, and your position on the bill.
Hi, my name is Juliet, and I'm here to oppose HB 1106.
When I was a teenager, I was queer in many ways. I came out as gay to my friends at 14 and then later as trans. I did not tell my parents these things out of fear of what they may do or say. In 2002, youths were getting kicked out of their homes and abandoned by parents left and right for being gay. I attempted suicide 4 times, and I was placed in a mental facility several times, all because I was a gay, genderqueer kid. I was afraid to tell my parents the root of these struggles, and I was left to drown. I finally came out to my parents, and thankfully they were accepting of me being gay. However, I tried to come out as trans to my mother years later, and that led me to be homeless and living on the streets. I know the impact of being accepted and the impact of being rejected. I failed my first transition attempt due to the lack of support, and as a result, I tried to end my life thinking I would never get to be the person I always wanted to be. Why am I telling you this? It's because support for LGBT kids can be life or death to many. 82% of transgender youths have considered suicide. That is not a small number. With as many as 2% of all youths being on the genderqueer spectrum, removing protections for the most vulnerable group of our people will result in death. And for everyone who votes for this bill, you will have the blood of those youths on your hands. My story is one of both acceptance and rejection. My mother was fine with me being gay, but not as trans. Choices that both saved and almost condemned me. In Texas Family Code, abuse is defined as act of omission that causes harm to a child's physical, mental, or emotional well-being. This includes causing physical injury, mental, or emotional injury. Taking away the protections of LGBT kids will inherently cause abuse. There's no way around that fact. It, however, will no longer be a protective value and is another form of erasure for LGBT youths. So I ask you to oppose HB 1106 and don't stain your hands with their blood.
Thank you. Thank you for sharing your story tonight, Juliet. We're going to go back over here. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
My name is Kit West. I am against the bill. Good evening. It's nice
And I'm so sorry. It's such a big room. You're going to have to lean forward and kind of like talk a little louder so we can hear you.
Good evening. It's nice to see y'all's faces. I have tried to come visit y'all to discuss this. I'm not going to read what I prepared today because after listening to these testimonies, I feel like I understand why so many people asked me to come speak to you today. I fear that the language in the bill is not specific enough to do what you're hoping it will. I ask that you would consider, rather than trying to define an inaction, that it would be more helpful if you were to try and describe what abuse would look like in situations of these. I did not know that I was transgender growing up. I didn't even know the word. I didn't know any of the language we use today. My parents didn't either, and it would not have been easily recognizable by any CPS investigator. But the behaviors I expressed that today we would label as gender dysphoria were nevertheless met with verbal, psychological, and physical abuse by my parents. To be treated as your parents' property, to own and control is undeniable, dehumanizing abuse. Children are not property, they are people. It took not one but 2 suicide attempts for family services to investigate my case. The Texas DFPS failed me. I have seen it fail many more children in my career, including the child whose letter I brought today. I've kept this letter for 7 years and I wanted to read it to you, but I beg you, please don't make that list of failures for Texas longer. Please put more thought into this bill before sending it through as it is. That's all I ask. Thank you.
Thank you. Thank you for your testimony. Members, any questions? Again, thank you all for sharing your stories tonight and for staying so late. The chair calls Morgan Davis and William Breeding. Morgan Davis and William Breeding. And my apologies for y'all being the last. It's just how the computer paginates. I have no one else listed to testify. So if you are here to testify, come forward. If we have missed your name or called your name, please come forward and join us at the table. Last call to testify on HB 1106. We're going to start right here, and if you're registered, go ahead and sit down. If you're registered and we just when we called your name you didn't come or something happened on the computer, you don't have to register again. If we didn't get you in the computer, we'll have to have you register. So
I registered my position. I didn't register to testify.
So you want to testify now?
Yes.
Okay, we're going to start here. We're going to work our way across, and then we'll make your adjustment. You don't have to re-register. We'll just mark that you testified publicly. If you would, state your name for the record, who you're with, your position on the bill, and if you would, lean into that microphone.
Thank you so much, and thank you for your grace this evening. You've worked so hard and so late tonight. My name is Morgan Davis. I am here in opposition. I am a former investigator for Child Protective Services. I am a former clerk and judicial aide for the 126th Court, which is our Child Protective Services Court here in Travis County. I can equivocally say to you that not a single child has been removed for this cause. As an investigator, when I go into the homes, I'm looking to make sure a child is thriving. I'm trying to make sure that a child is not in imminent danger. As an investigator, I've gone into many, many homes, and as in court, cases into the thousands. I'm also currently working for the District Attorney's Office. I'm not here in that capacity, I'm only for myself, but I'm also with the Travis County District Attorney's Office and Child Protective Services Court. Again, I can tell you, not a single child has been removed for this. And these are hardworking people doing a hard job, and they're just looking to make sure that these children are thriving. I got to get you from point A to point B as you see it, as a child sees it. One of my favorite things that the judges says, let a child be a child. This will do a little bit more harm than good. Not a little bit, it's going to do a lot more harm than good. With the kids now, we took them out of school and didn't return them for 2 years. We scared them. And then we bring them into court and we scare them a little bit. I just want to give them hope. I want to give them confidence. I want to tell them you're safe here. And my name is from the hardest working man I've ever known. It's my grandfather. It's Hardy, but my grandmother called him H. So I'm just asking today, please, give the kids a little bit of hope. Don't do this. Thank you so much for your grace.
Morgan, thank you for your service as an investigator. It's one of the hardest jobs.
Thank you for your grace.
Had a lot of bills that come through here and do a lot of work in that regard.
Hard, I
We had
promise.
bills earlier today that touched upon that, so
Thank you, ma'am.
thank you. If you would, state your name for the record, who you're with, and your position on the bill.
My name is Melody Tremolo. I am vehemently opposed to this bill. I am testifying on behalf of myself. I am not registered at the moment.
Okay, great. So right after you finish testifying, we'll have you go over there and register.
Of course. This bill is heinous. It is absolutely monstrous. The fact that you are removing protections from children, protections that are proven to help. The suicide rate of LGBTQ plus youth that are not affirmed by their parents is 8 times more likely to commit suicide and 6 times more likely for heavy depression. That's insane. The fact that you are going to remove protections like that and increase the suicide rate of children. That's not helping. That does not help children at all. You say you're for families, but quite frankly, something like this is absolutely not. Further, you want to push kids into a little box that defines them and restricts them and does not let them grow. That's not great. That restricts their personhood, that increases resentment against your families, and that is how you get children that when they hit 18, they move out of their parents' house and they never speak to you again. Quite frankly, the solution is simple. You just accept your kid for being who they are. whether they're gay, they're trans, they have blue eyes or brown eyes, whether or not they are, you know, you just need to let kids be kids and grow up into who they are. It really is that simple. That decreases the suicide rate by astronomical amounts and brings it down to the levels that you would love to see for, you know, your normal kids, your cis kids, your straight kids. They don't have as much depression because they are accepted for who they are. And if you accept your trans and gay kids for the same thing, guess what? They've got this comparable suicide rate. So you want to help families? Do it like that. You quite frankly have a corner of people over there that are wonderful and good people, proof that you can be gay and trans and you still come out, hey, well-adjusted to this society, a contributing member. Do you really want to take that away? Do you really want the death of kids on your heads? Because that's what this bill is going to do. I'm Melody Tremalo. I vehemently oppose this bill.
Thank you. Thank you for staying so late tonight and being here. If you would, state your name for the record, who you're with, your position on the bill, and you may begin.
Hello, my name is Spencer Cook. I'm representing myself, and I am against this bill. Under a reasonable standard of care, a parent would affirm their child. Simple affirmation. As a friend of many forms of trans people, I get to see the way each different family's treatment of a trans child affects their growth. Under a healthy, educated, and inclusive household, I've seen trans kids flourish into wonderful adults with long lists of prospects, a love for life, a drive to make our world better, and a life where their identity isn't a barrier between them and the love that they deserve. Under restrictive, uneducated, and exclusive households, I witness stress, I witness isolation, I witness abuse. I witness people trapped in a cocoon. I know many people still without a name to call their own. And there was a person over here earlier that had mentioned a vague case about CPS going over to families of affirming families and threatening their kids. Of course, I know of a real case of, they were talking about non-affirming families. I'm talking about affirming families of a real friend of mine who was threatened by CPS and spent his junior year fighting court cases to make sure he wasn't taken away from his mom and put with his father, who had a record of abuse, of actual physical domestic abuse. Anyways, but that's his story. That's not mine to tell. I will say I do witness stress in healthy trans folk, but it's not from their families. It is from the state. It is from this state. And from the countless attacks by this legislative body, from mandates trying to retroactively charge happy families with abuse, and of course the tactlessness of this body to propose legal protections for torturing queer kids, which is conversion therapy. I'm referencing conversion therapy. It doesn't really surprise me. I don't really have faith in this board anymore. This is not a place of respect. It is a mockery of it. I will tell you, and I'll scream it if I have to, I came here on a cashier's salary to tell you to stop hurting my friends. And that is my testimony. Thank you for your time.
Thank you. Thank you for your testimony. Senator Blanco.
Thank you, Madam Chair. Thank you all for your testimony. Question, you've worked in child protective services, according to your testimony, is that,
Sir, yes, sir.
Correct? And you had mentioned that this really isn't a problem, what this bill addresses. Is that accurate? Do you have any data that demonstrates that this isn't a widespread problem in the state of Texas?
Sir, in my experience in court and as an investigator, I would say one is we affirm our children. We want them to be uplifted. We do not want them to be bullied. But sir, for data points, not a single child has been removed for this. And in my knowledge, and as well outside of Texas as well. But sir, my apologies, in Texas, no sir.
Now, one has been removed.
Not a single case, sir.
And we haven't been presented any data this evening about how big of a problem this is in the state of Texas. Can you tell me how many, I'm looking at some data right now, and in 2023, there were 58,000 confirmed child victims of abuse in the state of Texas. Can you, in your experience, what percentage of those causing the abuse our parents.
Sir, forgive me. Apologies. I'm a little nervous. Could you repeat the question one more time, sir?
Sure. In 2023, there were 58,000 confirmed child abuse cases in the state of Texas.
Yes, sir.
Do you happen to know what percentage of those cases were confirmed abuse by parents?
Sir, apologies. I could not give you accurate data to that point.
75% of those cases were confirmed parent abuse. So what, I'm not, the data, you should follow the data.
Sir, yes, sir.
And I just don't see any data presented this evening that this bill would fix. And I think it's our responsibility as a body that we protect the most vulnerable.
Yes, sir. Pardon me.
And I think those are children, regardless of how they identify.
Absolutely, sir. Thank you, sir.
Thank you.
Thank y'all. Any other questions? If you would, please register. Craig, wave right there. There you go, Craig, if you'd register with Craig. I want to thank everyone for staying so late tonight. I want to thank the members for your attention to all the bills that we've heard today. We will not be voting tonight. It is the chair's intention to have a meeting on Friday. Maybe we might have a formal, if it makes it easier on Sally. We'll see. We're moving a lot of bills right now. So if there is no other business to come before the committee. Oh, I'm so sorry. It is the chair's intent to leave House Bill 1106 pending before the committee. Is there any other business come before the Senate Health and Human Services Committee? Hearing none, without objection, we will, the chair will have the committee stand in recess, subject to the call.